Good evening and welcome to the January 20th City Council meeting. I am Jim Nash. I am the City Council President, and I will be presiding this evening. This meeting and all participating on Zoom will be audio and video recorded. Tonight, we are operating under our new rules, and we will be doing things a little different than in previous meetings. One rule change is we will first convene the meeting before we take public comment. I now call the council to order. Pam, can you take the roll call, please?
Good evening. Councillor Elkins?
Well,
Councillor Foster?
I'm here. Did you get Councillor Elkins?
I did not, but I'll get back to her. Yep. Okay. Councillor Gore?
Well, let's get her on mute to co-host.
I don't think she's on.
Yes, I'm
okay.
tending to these now. Sorry about that, folks.
Oh, okay. Councillor Jarrett?
Here.
Councillor Labarge?
Here.
Councillor Maori?
Here.
Councillor Moulton?
Here.
Councillor Nash?
Here.
Councillor Perry?
Here.
Councillor Elkins?
Councillor Elkins just texted me that she's having technical difficulties and she's working on getting on.
Thank you.
Okay. And we got Councillor Gore?
I did, yes.
Okay,
Yes.
excellent, good. I was busy unmuting and not listening so well. Okay, so we are convened. Do we want to make sure we have Councillor Elkins here?
I'm here.
Okay, there, everybody's here. Okay. Now that we are convened, we will take public comment. If you wish to make a public comment, please use the raise hand feature. The raise hand feature is in the bottom menu bar under reactions. If you are calling by phone, you can raise your hand by hitting the number *9. If you are having trouble raising your hand, you may use the chat feature to send a message to me. To ensure equal access and because of the open meeting law, technical problems such as not being able to raise your hand are the only thing the chat function is used for, and it will only be available during public comment. We cannot accept comment over chat, private chat, or chat only visible on Zoom during a public meeting is antithetical to an open public process in violation of the council rules for public participation and violates the spirit and potentially the law of open meeting law. If you want to submit a written public comment, please email it to citycouncil@northampton.gov, and it will be sent to all councilors and will be part of the public record. I will unmute each raised hand in order raised to make a comment before you begin. Please state your name and your city or town for the public record. To ensure everyone has an equal opportunity to speak, the council limits comments to 2 minutes. You are in no way obligated to use the full 2 minutes, but if you do, after 2 minutes, I will ask you to please finish your sentence. According to the council rules, we do not respond during public comment as it is your time to speak. So while your comments should be directed to us, you will understand when we don't respond. Our rules also state the councilors and members of the public shall conduct themselves with civility and respect at all times. Your protected speech is a constitutional right and one that we will ask you to wield with consideration and respect for all, and with recognition that the public space that grants you that freedom is shared equally by everyone. Also, according to open meeting law, if someone is disrupting a meeting, they may be removed. You may speak on any topic. It doesn't need to be on an item on the agenda. I ask that all but the council turn off their video until called upon. Only the person recognized has the floor, and all comments are to be directed to the council. The meeting can also be watched on Channel 15 or by streaming on Northampton Open Media's YouTube and other platforms. Okay, I see that we have two raised hands so far, three. Karen, would you be able to help me? Counselor Foster, would you help me out with timer?
I'm ready, Jim. Counselor Nash,
Okay,
yes.
thank you. All right. Ask to unmute. Hello, Josh.
Hi there. Hi, my name is Joshua Yearsley and I live in Northampton. I just have a short comment on COVID mitigation and health policy. So as we all know, the coronavirus will continue to live with us even after the pandemic ends. And so to prepare for a future where COVID is endemic, we must implement sustainable, proactive health policies that protect us all. So while our city has implemented many health policies, I haven't seen any initiatives to improve the air quality of our city's businesses. We know that COVID is an airborne illness, and air filtration removes coronavirus from the air, which reduces transmission. Even more, air filtration helps to prevent other respiratory illnesses such as colds and flus, and it reduces indoor particulate pollution that contributes to cancer, heart disease, and lung disease. Here's a straightforward policy to improve air quality for our businesses. Give them grants to buy air filters. A high quality standalone HEPA filter that covers hundreds of square feet only costs about $200. The city was recently gifted $500,000 by Smith College for use at the mayor's discretion, and just a small fraction of this gift would pay for a grant for every business in the city. Improving the air quality of businesses is not only good health policy, but good business policy. A business with cleaner air will have fewer workers out sick and will attract more customers who want to stay healthy. If you need help creating this policy, look to the Northampton school system. They have already improved their air filtration by purchasing standalone air filters and by assessing their building's ventilation. Cleaner indoor air will save many, many lives over the years to come. So I urge the City Council to work with the Mayor and the Board of Health to make this happen. Thank you.
Thank you. Okay. Member Megan Peck, you have the floor.
Good evening, councilors, Council President Nash. A belated congratulations to and thank you to our new councilors, Gore, Perry, Elkins, and Moulton, and of course, Mayor Shara. So I'm Megan Peck. I'm a Northampton resident and the vice president of the high school PTO. I'm also a parent of a student that both bikes and drives to the high school. So along with several parents and community members here today, I'm here to support Ordinance 22.004, which bans the U-turn at a crosswalk, which is probably the most congested intersection around the high school. So this block of Elm between Woodlawn and North Elm, particularly in the warmer fall and I assume in the coming spring months, teams with cyclists and pedestrians and vehicles going every direction, especially around the morning arrival at 9 a.m. and afternoon dismissal at 3:30. As most of us are aware, there was a fatality of a cyclist who was hit by a driver turning from Woodlawn onto Elm Street in October. And those of you at the last council meeting know that survey by the high school PTO was mentioned on the perceptions and experiences of traffic safety for pedestrians, cyclists, and drivers in the area. The first survey we did in October was broadly distributed through the school community, and about 460 responded at the time the report was generated. That number went up to 600 eventually. So an overwhelming number, 16 and 54% of pedestrians and cyclists respectively, responded that they felt not at all safe before school started at 9 a.m. in the area. And between 56 and 63% of pedestrians and cyclists responded that they felt not
I'm
at
sorry,
all
that's 10,
safe.
Megan, if you can finish here.
They responded they felt not at all safe after school dismissed at 3:30. But an astonishing number, more than 140 of those that walk or bike in the area report having been hit or nearly hit by cars near the high school. So there was also an opportunity for open-ended responses following these multiple choice questions. And there the community members openly shared a range of complicated challenges as drivers and the many risks in the area for pedestrians and cyclists, most of whom are students and staff. Many mentioned the Elm Street block and the lack of safety at that crosswalk where too many cars attempt U-turns, which is addressed by this ordinance 22.004. So as I understand, this is from TPC members that this is one of several incremental interventions, including the elimination of parking spaces next to Child's Park on Elm that are going into effect in the immediate term to alleviate the number of cars that are both speeding through and stalling for pickups and drop-offs on a very busy side of the high school.
So Megan, I hate to cut you off because you're making such terrific points, and also that we have changed to 2 minutes for public comment rather than 3, and I suspect you prepared for 3, but we have to move on. But thank you for your comments, and also please forward them to the council. We'll take note of them. Thank you. Okay, next up is Jordan Abbott. Jordan, are you able to unmute? Okay.
That's better. Sorry. I guess I had to wait for you to ask me. Okay. Good evening. My name is Jordan Abbott. I live on Gleason Road in Northampton, and I am also here to speak in support of the ordinance prohibiting U-turns at the North Elm Street intersection in front of Northampton High School. Many individuals and groups are discussing a range of efforts to address concerns about roadway safety in the vicinity of the high school. For example, I met earlier this week with a group of parents, members of bicycling advocacy groups, and an NHS student representative to discuss potential school policy and educational interventions to improve safety. While these efforts are underway, I believe it's essential that we move forward with the recommendations resulting from the Transportation and Parking Commission's commitment to improving safety through structural changes. Passing the ordinance prohibiting U-turns at the North Elm Street intersection is a critical next step. Thank you very much.
Thank you. Next up is Amy Cahill. All right.
Am I
You have the
muted?
floor.
Hi. Thank you. My name is Amy Kaling. I am the Executive Director for the Downtown Northampton Association, and I'm here to speak in support of item 22.019, which is an order temporarily suspending the effect of certain ordinances in response to efforts to support renewed economic recovery efforts in compliance with the requirements of COVID-safe social distancing. In other words, making it easier for restaurants in our downtown Northampton and downtown Florence neighborhoods to engage in outdoor dining this upcoming season. When this order was first passed during the early days of COVID, this was invaluable in allowing the rapid coordinated setup of outdoor dining within our downtown communities. You may remember outdoor dining was critical during those days, as it was one of the first ways that our community began to feel comfortable returning to downtown. For many of our restaurants, outdoor dining was the difference between staying open or closing, between layoffs and retaining staff, between barely scraping by and paying monthly expenses. We're still very much deep in the COVID weeds, and outdoor dining once again is a vital lifeline for many in our restaurant community. We've shown last year that our restaurants, the DNA, and the various city departments can work together to create outdoor dining plans that balance competing needs. And the significant time spent creating outdoor dining plans over the past summer provides solid footing to get this year's outdoor dining up and running while allowing us to learn and improve. Without this particular order in place, the logistical challenges of creating outdoor dining in our downtowns will be draconian at best. Our restaurants are facing challenges at every level: rising food costs, rising wages, staffing challenges, supply chain issues, and more. I'm here to ask you to please not add additional hurdles that would impact our restaurants' ability to engage in outdoor dining this year, and to please support item 22.019. Thank you.
Thank you, Amy. Okay, next up is George Kohat. George, you have the floor.
Good evening, councilors. Thank you very much. I'm going to talk really fast now so I can get inside my 2 minutes. I'm here also to support the second reading of the abolishing U-turns in front of the high school, which is ordinance number 22.004. As Megan and Jordan alluded to, I was also part of a parent-teacher community members meeting the other day to discuss this and think of creative ways of trying to mitigate the traffic, which only seems to be increasing at certain times at the high school. I'm president of a local nonprofit called the Friends of the Northampton Trails, whose mission is not only to improve and make more popular our great rail trail network in the city, but also to promote the use of bicycles and pedestrian activity in safe and courteous ways. We also, unfortunately, our city schools in the past 5 to 10 years, we've seen vehicle traffic only increase because less and less students are using the buses for a variety of reasons. More and more students are being dropped off and picked up by their parents, or they're driving themselves to school. I am also aligned, our organization, Friends of Northampton Trail, is among a collaboration of citizens and nonprofits, which loosely termed Safe Streets Northampton, which is trying to look at creative ways of working with the DPW, the City Council, the Planning Office, to try to extend a whole safe street mentality and physical changes to the city's byways. Part of that we're glad to see maybe happening in downtown with the Main Street redesign. There's only so much that we can do, of course, due to the culture, the car culture in America.
That's time, George, if you could
We're
finish with
working
that.
hard. Thank you for supporting the second reading of 22.004.
Thank you, George. Okay. I don't see anybody else for public comment. Anybody see anybody I missed here? But I think that's it. Okay. We've completed public comment. Next is announcements from counselors and the mayor. So counselors, any announcements? The Counselor Jarrett.
Thank you. I'd like to announce that there will be a public forum next Thursday, January 27th at 7 o'clock. This will be with the planning board, and it's about zoning changes for form-based codes, also called character-based zoning, for downtown Northampton and Florence Center. There will also be a discussion about the future of 33 King Street, the former probate court. And the meeting details will be posted by this Tuesday evening on the city's website.
Thank you, Counselor. Any other announcements? I would like to announce to counselors that that we have a requirement to work on conflict of interest law, and Counselor and City Clerk Powers has forwarded that information, and I have forwarded it to all of you. And with with Clerk Powers here tonight helping with the minutes. Pam, could you give a quick overview of what those communications are about?
Sure. So once a year, the city is required to pass along the summary of the conflict of interest. You can find it on the state's database, but I shared it with Councilor Nash earlier today, and I think that that's what he forwarded to you. In addition, every 2 years, city employees are required to go online and complete the online training component of conflict of interest. And that is about a 45-minute investment of time. At the very end, you get a certificate of completion. And that certificate of completion, along with your acknowledgement that you've received the summary of conflict of interest, needs to be forwarded to the HR department. So I think all that information is contained in the email that I sent along today.
Thank you, Pam. Mayor, do you have any announcements to share? She's muted. Did we mute the mayor? What the?
Thank you. I don't, but I have, I've asked our health director, Meredith O'Leary, to join us. I don't, so she's doing double duty right now. There's also a Board of Health meeting happening, and I know that she was gonna pop on over. I'm not sure that I see her just yet, but you know, I'd asked if she could give an update just sort of on where we are during this Omicron surge and just kind of brief the council on the situation. So I think she is trying to get here, but I don't see her just yet. So I don't know if there's anyone else who has an announcement, and we can come back to Director O'Leary when she pops in.
Yeah, I'm fine with accommodating Director O'Leary.
Oh, I see her.
Excellent.
Okay. Director O'Leary. She won't be able to unmute, so if you can unmute her, that would be great.
Do you see her, Karen?
I do.
Can you hear me?
Yes.
There you go. Welcome, Director O'Leary.
Thank you very much.
So Director O'Leary, I just explained that I was hoping that you could just kind of brief the council on, you know, the situation we're in right now with the current surge and any sort of updated numbers or anything that you'd like to impart to the council and the city about the state of things right now with COVID.
Absolutely. I put a few slides together. Am I able to share my screen?
Sure. Let's co-host. You should be able to do that.
All right. I cannot see anyone, but that's okay. I can get through it. So anyways, thank you for inviting me tonight to kind of give you a COVID overview of where we're at now.
Meredith, your screen isn't showing.
It's not showing. Okay.
Okay.
What do I have to do that? Share screen. There we go. Can you see it now?
There we go. Excellent. Thank you.
Yep, got it.
Oh, great. Okay. I'll just make it. There we go. I'm just going to shut my door. Give me 1 second. Sorry about that, counselors. I've been jumping from one meeting to another.
That's fine.
So for those new counselors, congratulations and welcome. I'm Meredith O'Leary. I'm the Public Health Director for the City of Northampton. I have been the Health Director for Northampton for a little over 10 years now. And it's my hopes that I retire from this position. This was my end game when I thought about public health, where I wanted to land my 2 feet. The City of Northampton was it. I've been working in public health now for probably close to 20 years in a variety of roles. I did a lot of 8 years in Holyoke. I did some years in Pittsfield, and I've loved each community that I worked in, but Hampshire County is my home, and I'm proud to be serving for the City of Northampton. So I just wanted to give you a quick little background about who I am, and now I will go into some COVID updates, and I put some slides together, and I hope that I can make everything work here. So in December of 2019, COVID, SARS-CoV-2 started ravaging the world, and for the past 2 years has taken a significant toll on our community, our healthcare systems, businesses, schools, social systems, and state of mind, and has had many severe mental health impacts. I thought that at that time in last February, if we could get through this, that next year would be better. There'd be vaccines, there'd be more treatments, there'd be more immunity. But instead, we got Omicron and a confusing new phase of the pandemic. To solve the public health crisis, it's not enough to get the science right. There's also challenges with supply chain, infrastructures, research, production, mass communication, political trust, and inertia. Balance of epidemiological data and sociological realities has really hit me, where I never, in all of my 20 years of emergency preparedness planning, never thought of those things colliding, I should say. So tonight I'm going to present you with Northampton specific COVID data, transmission, where our community hospitals are at, vaccination efforts, and what we're doing to help curb transmission rates in our community. So the first slide that I have, and I have to move the Zoom box, okay, is our COVID cases, our comprehensive cumulative COVID cases in the City of Northampton from when we received our first case in March 16, 2020. So to date, we have had, and this isn't to date as of this morning, because I actually just got this data about a half an hour ago. So those of you might have been on our Board of Health meeting earlier today, the number is a little different. So we've had 3,463 cases, confirmed and probable cases to date. Confirmed cases are those that are confirmed by laboratory molecular PCR tests, and then probable cases are those that were proctored positive antigen tests that got submitted to the State Department surveillance system. So you can see we've had 4 major surges. We've had spring, winter, fall, and then our present surge to date. What I did to give you something to compare to is this graph over here is from July 2021, and it's only showing the current surge that we're in. And what it does is it shows you how cases are skyrocketing. And this kind of makes sense because you can see it. Here is December, here is January. We see the steep incline right here, which is right after the holiday season. And which makes sense because we have a lot of indoor gatherings, family gatherings. And we also had a delay in testing because of the holiday season. The lab that's primarily used in Massachusetts, the Broad Institute, was shut down for a couple days. So that's why we have some higher daily rates right in here. So it all makes perfect sense to me. We kind of see right here that we might be hitting a little plateau, which would be amazing. If we're following national and state trends, then hopefully that is the case. And we'll have a couple weeks of a plateau, and then we might see a decline. So this this number right here, the 3,463 that I gave you, isn't really representative of our community cases that we have right now. It's completely underreported. One, because people have had a lot of issues with getting tests. So they've been doing the antigen at home tests. Those antigen at home tests are not reported to the Massachusetts State Surveillance System called MAVEN. So they're not included in our counts. And then we have those people that are sick, they've exposed, so they figure, if it walks like a duck and talks like a duck, it's probably a duck. So they have coded and they actually don't get testing and they just follow the quarantine and isolation recommendations. So since January 1st, 2022, we've had 1,078 cases. So that's 1,078 cases since 20 days ago out of our 3,463 cumulative cases. That's 31% of our total cases to date. And then here on the right side of our graph, we have our incidence rates. The next graph is cumulative deaths and hospitalizations since March 2020. Hospitalizations and death rely on data collected from the individuals when we do our case investigations or looking at medical records or vital statistics. So therefore the data might be incomplete or undercounted. So you can see, what have we had? 135 total hospitalizations, and we've had 109 deaths so far since the beginning of 2020. Prior to vaccinations and COVID-19 treatments, COVID deaths and hospitalizations would rise very steeply, as you could see in the beginning of COVID right here. There was a very sharp increase, and we actually had low testing. So to compare the two wouldn't make a lot of sense if I put them on the same graph, because really the only people getting tested at this time were people in the hospital. So it's better just to look at this on a non-layered effect, on a non-layered graph. So the orange is the cumulative hospitalizations, and it correlates with the deaths at that time. And then there's been a slow increase over time. Again, we've had better testing, better treatments, and we've had vaccinations come out. So you can see here, vaccinations came out. Let's see, right here, right around here, we started vaccinating January 11th. We kind of have flattened the curve a little bit. Next slide. The next slide is COVID-19 cases in Northampton, breakdown by age and vaccination status. The blue graphs are unvaccinated. The orange are those that received their primary series, and then the blue are those that received their boosters. And then it breaks it down between age group. Oops, sorry about that. So according to the Mass Department of Public Health, Omicron makes up over 90% of all of our cases right now. Nationally, they're using the average of 99.5%. While we don't have sequencing for Northampton specific cases, we can make the assumption that based off the state data, the national rates, and the way that we're seeing transmission happen, that the Northampton cases are all around 95 to 99% Omicron also. With Omicron, people usually report their initial symptoms of fatigue, sore throat, congestion, runny nose, headache, and cough, though people with Omicron are still also reporting the other symptoms that we heard with Delta and the original variants of COVID-19. So people with Omicron still are losing their, have a loss of taste and smell, body aches, GI symptoms like diarrhea, vomiting, abdominal pain, and shortness of breath and dizziness. So all of the symptoms are still with this variant as they were with the other ones, but the difference here is our early variant, COVID variant, we would see perhaps fever being one of the primary symptoms, where now we're just kind of seeing the sore throat and congestion. The incubation time with Omicron is also a little different than our earlier variants. The average incubation period, meaning the time you were exposed to the time that you got sick, is about 2 days with Omicron. The other variants, it was anywhere between 4 and 6 days. Also, early evidence suggests that reinfection after infection of Delta is happening to prior days. And I say early evidence, again, Omicron has really only been out less than a month. So we're still kind of dissecting the data that we have. So where is transmission occurring? It was far easier to contact trace and identify sources of exposure in 2020 versus now. In 2020, people's activities were very few outside of the home, so it was easy to trace back where they were exposed and who their close contacts were. This information would lead us to be able to better contain an event and reduce COVID transmission. Well, nowadays, people's lives are large. They're more back to normal, or maybe they're new normal living with COVID. They have more social interactions. They're working in person, they're traveling, participating in sports, going to performance menus. This is just to name a few things that people are doing, which leads to many more possibilities for exposure and many more possibilities for transmission if you don't know that you have COVID-19, because you can have COVID and be completely asymptomatic, meaning you don't have any physical symptoms. So we do see that a lot. So it's very, very difficult right now to identify the source. And then we have so many cases happening right now. I want to say up to the end of December, I can safely say that the health department contact tracing team was able to reach at least 95% of our positive cases for residents and businesses alike. And we were able to conduct contact tracing, meaning any of those who were COVID positive would let us know who was a direct close contact 48 hours prior to either becoming symptomatic or receiving a positive test. We would take those names down and we'd make those phone calls and let them know that they were a close contact, that they needed to be quarantined, and what that looked like. We were able to reach 95% of our cases and our close contacts. There was the state contact tracing collaborative. We didn't rely on that collaborative unless we had a very large outbreak with lots of close contacts, and we'd ask for help then. Or if we had an outbreak in one of our long-term healthcare facilities, maybe like a nursing home, we would bring in the state epidemiologist and their contact tracing team. The state contact tracing team November 30th, excuse me, no longer was taking cases. So November 30th of 2021, they stopped taking cases, and any open cases they closed out through the month of December. This really in December didn't have an impact on us because, again, we weren't sending cases to the state contact tracing team. We had our own contact tracing team here. I think I had 6, 7 nurses on a very part-time basis, and the schools also had a contact tracing team, and we worked with the school contact tracing team, and we were able to contain. Well, now with the spike in cases and, again, not knowing transmission is occurring, it's really hard to do any type of containment. We are only reaching about 50% of our cases on the whole. So what we've had to do is we've had to prioritize what is important in our community and specific settings. So we've prioritized our school age kids, 18 and under, our elderly who are 60 and older, cases in congregate care settings such as group homes, rest homes, daycares, nursing homes, etc. And then additional positive cases who might have to, who are exposed longer, therefore might have to quarantine longer. So we've really had to prioritize, which has been difficult. and almost feeling defeated, but we have to be realists. Our team is burning out very, very quickly. So that's where we were, and that's what's happening right now. In regards to our hospitals, Cooley Dickinson Hospital is over capacity. This slide was given to me by Dr. Levin, the Director of Infection Control at Cooley Dickinson Hospital, so it's pretty current. And you can see the surges of the hospitals. We have 4 surges that have happened over the course of the last 2 years. At their peak, we just hit that this weekend. We had 28 COVID positive inpatients there. At this rate, the hospital really is not functioning as normal. Cooley Dickinson Hospital has cut down on their elective procedures and surgeries. Procedure staff are helping out in other areas or other floors where needed. The beds are totally full. People are being admitted on paper but don't have a bed. Some are being held in the procedural area. So the bottom line, though, CDH is not functioning as normal or as an ideal manner, it is still functioning. The good news that I just heard earlier this morning is their workforce is not as diminished as it was 7 days ago. So they have less people out sick due to COVID reasons, which is a silver lining when we're looking at all of this data. So absences are down. Okay. Next, I'll just go into a little bit about our vaccination efforts. Vaccine is the single most important tool to combat COVID. We opened our vaccination clinic at the Senior Center on January, so just a little over a year ago, to support the state in getting the first responders vaccinated. When given the opportunity to continue to vaccinate as the other eligibility groups opened up, we knew that it would be a daunting task, but it was our duty. So for over a year now, we've held anywhere every single week since then, anywhere from 4 to 10 vaccine clinics a week. Some days we would hold 2 vaccine clinics in 2 different locations, yielding in about 43,000 doses that we've been given so far. We've also, as a team, had to roll with many punches that have been handed to us by the state, one being very early on, lack of vaccine. We had capacity. We were telling the state we could do 1,200 vaccines a day at the senior center. We were ready for it, but we weren't receiving the vaccine. They asked us to ramp up. We ramped up, but didn't get the vaccine to administer, which was very, very unfortunate. We've had to deal with crashes in the state software system. We've had to deal with angry, anxious public. The stress and the always urgency need of getting people vaccinating over the past year has been extremely taxing, but also extremely rewarding. So early on, again, like I said, we started our vaccination efforts at the senior center, and I think we were there probably till June or July. And we went from doing 1,200 a day and people clamoring for appointments to 30 a day. It happened overnight. It was very interesting. So from there, we realized we needed to kind of assess where we were going to put our efforts, and that was more about health equity and reaching the underserved populations. So a couple things that we did is we talked about doing, oops, excuse me, wrong screen. Doing vaccines at different sites, more of like pop-up vaccine clinics. So we also did mobilized a regional vaccine clinic team to go to other Hampshire counties communities to reach people where they're at, because we knew that talking through other boards of health through our Emergency Preparedness Coalition, that some people in some communities weren't going to come to the city of Northampton or Springfield to get their vaccine. So we really wanted to think about equity. So you can see we've been to a number of different places giving vaccines. We take pride in the city of Northampton that at any given point, anybody could have gone 1.5 miles from their home and received a vaccine somewhere, whether it was one of our pop-ups or a Walgreens. But that was extremely hard work to make sure that this was equitably done. So we have gone, we've gone to the schools, we've gone to, one of our best ones. We've gone to the Northampton Housing Authority properties, low-income properties, elderly properties. But one of our really most successful and rewarding clinics that we had was the one in Pulaski Park. We would set up literally 2 tables, a couple computers, a couple vaccinators, and a couple ambassadors, and sit there every day in all sorts of weather. And it was more about garnering trust from the unhoused population in the downtown during those warm months. We had people that would come up to us every single week and just ask for information. And it could have been 6 or 7 weeks later, they finally came to get their vaccine. And it's because they were learning to trust us and getting the information from one source that was very consistent and uniform. And I really think that changed people's mind in getting the vaccine. So I have to say, you know, those days that we did 1,200 people was rewarding, but changing one person's mind who was kind of a hard no to a yes after, you know, 6 or 7 conversations, that's really where the boots on the ground hard work is done, and, you know, makes you sit back and say, yes, this is worth it. So we've been busy, as you can see. All right, let me go to the next slide. And just to let you know, we have throughout had all 3 vaccines available. We have Pfizer, we have Moderna, and we have J&J vaccine. So if anybody is listening and still needs a vaccine, you can go to the City of Northampton website and you can make an appointment. You can also go to mass.gov VaxFinder, make an appointment there, or you can just call the health department at 413-587-1215, and we too will help you make an appointment and register you. So, or you can even just show up at my office and we'll help you out. So this slide here, Northampton vaccination coverage, current as of the 13th. So 78% of our Northampton population have received their full primary series of vaccine. 81% of the eligible population, which is 5 years old and older, have received their full primary series of vaccine. Only 46% of the population has received their booster vaccine. This is really more difficult to determine how much of the population is eligible, since it's based both on time since the primary series was given and the age of the individual. So it's really kind of hard to dissect what that would look like. Vaccination uptake differs among different groups. Individual booster coverage does increase, as you can see, as age increases. And that also can be because they were eligible for their booster a lot sooner than our folks down here. The next slide is vaccine coverage by race and ethnicity in our Northampton population. There are clear disparities in vaccination rates among different races and ethnicities globally, nationally, and also here in Northampton. Vaccine equity and health equity are complex. The driving forces and disparities are different for different minority groups. Some factors is distrust in medicine, distrust in healthcare, in healthcare in general, inequitable public health communications, miscommunication, lack of peer support. There are many reasons why this varies, but I just wanted to give you a breakdown of the vaccine coverage there. Next slide. So these graphs, this is the history and transmissibility of COVID. These graphs show fatality and hospitalizations broken down by age and vaccination status. Based on these graphs, we can see the risk for both death and hospitalization increase with age increases. That's nothing nothing newsworthy there. We knew that, but especially in the absence of vaccination. These graphs do not show the impact of underlying health conditions on both outcomes, nor do they show the rate of outpatient and emergency healthcare utilization for cases. I'd like to clarify that when people talk about vaccine protection and efficacy of vaccines, the words efficacy of vaccines from infection means a positive test is very different from efficacy of vaccines or vaccine protection from severe infection and death. So those are two different lingos right there. My point of view is we have really good data on the original strain and good data on the Delta strain, the variants, and we have very little data because it's new on Omicron. So when it comes to the history of transmissibility, with the original strain, we learned that our vaccines were extremely effective in preventing severe disease and death. And we saw that vaccines significantly decrease shedding and transmission of disease at that time when vaccines were first instituted. So what I'm saying in its essence, with the first strain, vaccines decreased transmission. In summer of 2021, we learned that we had a new variant, which was the Delta variant, and we learned that protection by our primary series was not as good as it originally had been of infection and transmission of the original strain. And actually, the CDC wrote up the experience of disease transmission in Provincetown on that July. And when they looked at the folks who had COVID and compared the ones who had vaccinations, the ones who didn't, they had the same viral load, the same amount of virus in their nose as the vaccinated. And this was news, and it was different from what had happened with the earlier variant. And this was really unexpected. And it's all documented in the CDC. Booster doses at that time were highly recommended, definitely improved things. And it was shown that during the Delta surge, those who were boosted were 5 times less to get and spread COVID compared to those who are unvaccinated. So again, we have really, really good data about the efficacy of the vaccine when it comes to severe disease, so protection and transmission. So unfortunately, recently in December, while we were still in a Delta surge, along came Omicron, and it has the highest transmission rate of every variant we've seen so far. It appears to be more resistant to our vaccine induced. While it's considered relatively less severe compared to other variants, it's still sending record numbers of patients to the hospitals with complications of COVID. The surge is only 4 weeks, 5 weeks old. So there's a lot what we don't know yet. Through case investigations, we're seeing that there are a lot of breakthrough cases, and we don't yet have good data to know if vaccines or boosters really protect significantly from transmission. So as you might recall, last week at the Board of Health meeting, we had a discussion around possible vaccine requirement for our downtown businesses. But right here, because we don't have that data to support it, my Board of Health had, a 2-hour conversation that without this evidence or data point, we really can't make a policy. So, but what we do know, and this is really important to stress, what we do know that vaccination, especially with your booster dose, which is now being called up to date on the vaccination series, continues to protect from severe disease and death. And we see that in our hospitalizations as well. So public health interventions, I cannot say this enough. The best tools that we have to reinforce, to curb COVID-19 would be getting vaccinated, vaccinated with the booster. They are our most important #1 tool that we have right now to curb COVID-19. However, during this unprecedented surge of Omicron, it's not the only tool. We still really have to be thinking about all of those important public health interventions that we have been thinking about since March and April 2020, right? Mask use. The city of Northampton has a mask policy. We've had it in place. It was reinstated last August. We strongly encourage that when you wear a mask, that you think about quality. Quality is a critical factor in preventing the spread of COVID-19. So I urge anyone to wear a KN95, KF94 mask, or a surgical mask, 2 surgical masks in any public setting. However, any mask is better than no mask. But if you do have a cloth mask, it's better to double it up, or perhaps put a surgical mask underneath your cloth mask, okay? So quality, definitely there's evidence showing matters when it comes to reducing transmission. We also still want to encourage social distancing, making sure that we keep 6 feet from other people when out in public. We want to make sure that you stay home when you're sick. Again, I mentioned what the symptoms, especially the early symptoms, are of Omicron. And honestly, having had it recently myself, I can tell you it just really started with a runny nose. So you want to be cognizant of your baseline, and if anything changes, you want to get tested. There is testing has been diminished a bit, but is starting to ramp back up, thankfully. And if you are positive or have been identified as a close contact, you want to make sure that isolation and quarantine guidance. So testing capacity, definitely since mid-December, right before the holidays, it was very, very challenging to find an appointment for a PCR test. But to get an appointment right now, I suggest you either go to mass.gov, stop the spread, or go to cumulative.org. There's starting to be more openings now because more sites are standing up. Here locally, 4 weeks ago, just about 4 weeks ago, the city of Northampton and the city of East Hampton partnered together to open up a drive-through PCR test site. It's open 5 days a week at Mill Park. Pre-registration is required, and you can go to cumulative.org to make an appointment. Also in the city of Northampton, for a couple weeks now, we've been offering PCR testing to anyone who works in a business in the city of Northampton and to municipal employees. And next week, we'll be opening it up to the general public, so for residents of the city of Northampton. And I'm hoping that we can offer that testing 2 days a week. Details to come once they're finalized. The city of Northampton had also been given from the State Department of Public Health 4,500 antigen rapid tests, at-home rapid tests, to give out to the underserved populations, low-income populations, those that live in congregate care setting, or those that might be risk of severe disease. And we worked with some partnering agency to make sure that those tests got out to the appropriate people, which is fantastic. And again, this, I often refer to the Swiss cheese model. Anything that we can, any layer of cheese that we can layer on top to fill up that hole, that gap, is called harm reduction and making it a safer place for all. So, in addition to what we've been doing, the state for testing, what we're doing here locally, starting yesterday, President Biden is offering free rapid tests for all residents in the United States. And you can order them on the, I think it's called covidtest.gov website, or there's also a call center that you can call to order your tests. And that number is 1-800-232-0233. So then that kind of leads us to what's next. And I love that picture of that plane because I feel like I've been building that plane and flying it at the same time and trying to navigate myself through the last 2 years. So this is kind of what I see on the horizon, though I don't have a crystal ball. It's just from the research that I'm doing and epi models that I've been looking at and professionals that I talk to. What I can tell you is this past week on the State Department of Public Health's interactive dashboard, it shows that there's been a ever so slight decrease of cases. And in the city of Northampton, you saw that we might have a slight plateau coming in front of us. So it's too early again to tell if this is going to be a trend or if it's just kind of a blip in a period of data. But we also have to be mindful that, you know, people who are taking the at-home antigen test, that those numbers aren't included in the data sets. However, you know, little glimmer of lights right there. But what's really important to me is this is the first week where the number of hospitalizations were down since the beginning of this surge. Hospitals are also reporting that the number of staff out due to COVID-related illness has decreased measurably. So that's a very good sign. Now, I'm not going to fool you. We're still in a time of unprecedented number of cases. And again, we're not even close to being back where we were in the fall of 2020, but the needle may be starting to move in the right direction. Additionally, an article that came out maybe last week in the Boston Globe reports that the amount of SARS-CoV-2 found in wastewater has significantly decreased, which may also be representative of the direction that we're moving in. So again, another glimmer of hope. But then I'm also asked, you know, the big question, are there other variants of concern on the horizon, right? I don't know of any right now, and I'm knocking on wood, right? There's nothing that has been identified as another variant of concern right now. But I say this, the experts, epidemiologists state that it is pretty good possibility that there'll be another variant at some time, okay? But certainly Omicron has woken us all up to the possibility of new variants. For another variant of concern to take hold in the same way as Omicron, it has to be more transmissible. It has to outcompete Omicron to take hold. We just happen to be so lucky that this variant, Omicron, was, well, more transmissible than the last two, but was much less virulent than the last two, meaning it didn't cause severe disease as the other variants did. Omicron happens to be an upper, for the most part, an upper respiratory illness, where the other two were lower respiratory, where we had more complications with pneumonia, people struggling for air, people having to be intubated or in the ICU. Our hospitalizations are up, like you saw, but we don't have as many people intubated or in the ICU as we did in previous surges with Delta and the original variants. So it didn't have to be that way. Again, I say we're very, very lucky that this is how it panned out, because it could have been more transmissible and more virulent, and that would have been devastating. So is this the end? I really have no idea. I don't have this crystal ball. Is everyone going to get exposed and or vaccinated during the Omicron surge? Will that bring us to herd immunity where everyone is protected enough to stop surging in this manner? We just don't know, but I am hopeful that this is it. I left my contact information on the bottom. If anyone in the public wants to contact me for more information, if any of the city councilors want to contact me for more information, please feel free to do so. But at this point, I'm open to any questions.
Thank you, Director O'Leary. Councilors, any questions?
Before you ask questions, can I just jump in super quick, Councilor Nash?
Absolutely.
President. I want to take a second to thank Director O'Leary, and I just want to point out how remarkable she is and sort of hold her up. And I hope our community recognizes what a remarkable public health expert she is. She and her team have been working nonstop for 2 years. And for tonight, I said, hey, can you just give like an update, maybe some numbers, but this is just so who Meredith is. Meredith never just does anything. She does everything at 150, 200, 5,000%. So I just want the council to recognize that and appreciate that with me. She's truly, truly remarkable. And her day has been remarkably long. I don't know when she managed to put these slides together. I thought she was just going to show you the spike and tell you some stuff. She's amazing. And I just want to thank you so much, Director O'Leary. That was a truly just unbelievably comprehensive presentation. So I appreciate it.
Oh, thank you for those kind words, Mayor.
Thank you, Mayor. And I too agree. We have a superstar in terms of public health here. This has been the health event of the century, and we've had Director O'Leary at the helm and really steering us in the right direction. Other communities look to us for what's going on, and that Director O'Leary has been the messenger of what people are supposed to be doing in our area. I see Councilor Labarge's hand.
Thank you, Meredith. Again, I will say, I want to thank you for the presentation tonight. It was absolutely, absolutely beautiful. And I want to thank all your staff, all the volunteers who have been working tirelessly for the past going on 2 years now. And I also want to thank you for making the decision of having the vaccines being given at the Elks on Spring Street. I can't tell you the residents who are so happy because it's close to home for them. So thank you, and please tell all your staff we appreciate everything that they are doing to help keep all our residents and children safe here in the city. Thank you.
Thank you, Counselor.
Any other questions? Councilor Foster.
Mostly just another expression of gratitude, Director O'Leary. I really appreciate you taking the time to come and give us an update, as well as to make the connection, with new counselors. I know that you've always been incredibly accessible when I've had questions or needed information or wanted to pass information along to constituents, and I've really appreciated that. And I think your accessibility here tonight will help new counselors be able to communicate with their constituents about it as well.
Thank you.
Councilor Maori.
Yes, I join in the thanks. Those are amazing numbers. I'm going to look at those for a while. 42, almost 500,000 doses. I was just wondering, I read that a certain amount, a limited amount of N95 and other favorable masks will be being given out at, I believe, I think it's supermarkets or places around in the area. Is that true, Director? And is that when is that going to happen, or where will that be happening?
Sure, that is true. So probably for the last 2 weeks, we've been working with the businesses. We kind of had some one-on-one conversations, my staff with the businesses, to see how it is at this time we could best support them. And what we heard over and over again is, because we were messaging that, better quality masks is where to be at right now, but they were having trouble procuring them. So I went to the mayor and asked if we could distribute them, if we could procure and distribute. And so we've been working with Amy Kahlin, who is the executive director of the business district, and she now is the distribution center. So she has reached out to all the businesses. We prioritized with the high-risk businesses, meaning those businesses where you might be apt to take your mask off and have interactions, and those businesses that have people of high-risk nature of getting severe disease. So we have set these metrics on who will get how many, or what types of businesses will get the masks, and she's taking care of the distribution. So they're warehoused in the fire department, and then she picks them up and then distributes. And it's not just people that are members of the business district. She is doing it very equitably. That was primary concern for us. And then we have a small cache of masks at our office, and oftentimes, we are still communicating with 50% of those cases that are coming in. And if someone says to us, I've got a family here, I'm positive and I don't have masks, we make sure that they are provided with the personal protection equipment that they need to protect the rest of their family. So they are going out to the public. And if someone just in general says, I can't get my hands on one, we've given them out. We, started giving out masks back in April of 2020. And I want to say we probably have given out over 40,000 masks, 50,000 masks to date so far. We had our staff, when inspections weren't happening because businesses were closed, with stacks of masks in their car and lists of addresses and dropping them off in the mailbox or the front porch way back when. So things have definitely changed, but we are still in the business of masks.
Right.
Councilor Mayor, you have another question.
Yeah, I just want to follow up. Thank you for that. That's really illuminating, and that's great to hear. That's amazing. You should be bragging about that too.
We won an award, actually.
Yeah, good. There you go. Excellent, because that's pretty impressive. And I guess my other question, just for kind of consumers of masks out there, today I was at a convenience store. I'm compulsively grabbing, N95 masks. But I grabbed one, and then I realized it just said not medical, fashion mask. And I was like, okay, maybe put this one down. And so if you're kind of shopping around, what would you recommend in terms of trying to secure, ideally, we all know that any mask is better than no mask, but so not to get too hung up on that, but, if you really want to try to distinguish, ideally the N95 masks and other medical masks, how would you go tell them to go about that direction?
So if you're searching online for them, they literally say medical grade KN95 masks.
Oh, okay.
And they have some standard stamped right underneath it. There are a lot of knockoffs, and we call them KN35 masks because they're only preventing 35% of transmission. So you really want to do a little bit of your homework and make sure that it has that standard stamp on that, and that it says medical grade. And then if you're looking at any other style of surgical mask, you want to make sure that it says double layered at a minimum. There are triple layered also.
Okay.
And the CDC just updated that, and they have 2 pages that talk about the different types of masks and protection that they do provide. And that the link is on our website too.
Great. Thank you so much.
Counselor Labarge, did I see your hand raised?
Yes, thank you. Meredith, now with the masks that you're talking about, that you're distributing, and Amy's helping out with that with all the businesses, are city employees also getting those masks?
They are. Yeah, they contact us at the health department. Excuse me, I still have a lingering cough. All they have to do is contact us at the health department and they can come get their masks there.
So if counselors want them, we just have to call and they can bring them into our council clerk?
It would be best if they come to the health department to get them. They'll just say how many. If Laura called us up and said we wanted, 20 masks for our counselors, we would just put them in a bag labeled for you and she can come pick them up.
Wow, thank you.
Any other questions? Okay, Director O'Leary, thank you. We release you, go home and have a nice evening after 2 meetings in a row.
Thank you. I really appreciate the time you putting me on the agenda tonight to listen to this. I think this information is valuable. And it just, I think, gives a spatial understanding of where myself and the Board of Health is coming from when we set policy, that we are really looking at granular data. It's not just having a magic wand and casting it because we feel it makes sense. We look at data from many different sources. So new counselors, welcome. Seasoned counselors, it's nice to see your faces again. Thank you, everyone.
Bye.
Bye.
Thank you, Director. Okay, Mayor, I think that was under your section here. Communications and proclamations from the mayor. Is there anything else you'd like to add?
There's nothing I can possibly add to Director O'Leary. So
That was terrific. Thank you for that. Okay, next up on the agenda is 22.021, appointment of Attorney Alan Seawall as City Solicitor. I'm going to read this this letter from the mayor because I think it's going to be pertinent to our discussion. I am appointing Attorney Alan Seawald of 60 Revelle Avenue, Northampton, Mass, as City Solicitor for the City of Northampton effective Tuesday, January 20th, 2022. Attorney Seawald's term as City Solicitor expired with the end of the term of Mayor Narkowitz and has been appointed on a temporary basis. Alan Seawald has served as City Solicitor for the City of Northampton since 2012. He brings in an unparalleled wealth of experience, expertise, and wise counsel that has helped guide the city to the stability Northampton currently enjoys. I respectfully submit his appointment to the City Council for confirmation in accordance with Section 2-10 of the Northampton City Charter and Northampton Administrative Code, Chapter A, Part 2, Section 2-02. I have attached a copy of Attorney Seawald's professional resume for your review. So before us now is the appointment of Attorney Seawald. And I think that one of the things we have to figure out is whether we can appoint him tonight or whether or not we, within the language of the charter, we need to refer him to a committee. And Mayor Shara.
thank you. I'll let you all answer that question, or perhaps Solicitor Seawald will help you with that. But if I may, I would like to speak to this appointment and just say that I'm very happy and quite proud for this to be my first appointment. And, according, as you just read, according to the city administrative code, the city solicitor is appointed by the mayor, and the term of that appointment does not extend past the term of the mayor. So, as legal issues don't stop, I believe my very first act on January 3rd was to appoint Solicitor Seawall as to an interim appointment. And so now I'm very, as I said, proud to be bringing forward the actual appointment. Those of you who have worked with Alan in the past know that he's not only an excellent attorney and a foremost expert in Massachusetts municipal law, but he is also kind and very available to advise and answer questions. I always love the line that he says to new counselors or new members of a body that, if you ever have any question or something you're not sure of, or something feels like it might not be legal, just please call me first. He always makes sure that he tries to protect all of us in the city. So as the city solicitor, he represents the city, and that means the council. And, I know that as a counselor, he was extremely helpful and always willing to talk to me about any questions I brought to him. And I felt very supported by him in my position on the council. And particularly in the last term when I was the council president, we spent a lot of Zoom and phone time together navigating the new world and the processes that we were suddenly thrown into because of the pandemic. So those of you who are new to the council, hopefully with the council's approval of this appointment, I look forward to you also getting to know him and leaning on his wise counsel. And I just want to add one more thing on a personal note. Something else that has really meant a lot to me when I've talked to him about this reappointment is how much it means to him to serve his home and community. He is a longtime resident of Northampton, and believe me, any municipality would be extremely happy to snap him up as their solicitor. He is truly a giant in his field, but he has expressed to me that it's incredibly meaningful to him to serve his community, the community where he's raised his children and has built his life, and that definitely resonates with me. So, as I said, I'm very proud to put forward this appointment, and I ask the council for your approval for this very important position in the city.
Thank you, Mayor. Councilors. Councilor Jarrett.
Excuse me, Councilor Nash?
Yes.
Just a point of order. Can I have a motion to put this on the floor?
So, Assistant Powers for this meeting, thank you for being here, first of all. We really appreciate you being here. And under the new rules, we can do a little discussion to consider what motion we're going to make ahead of time. So
okay.
That's what's occurring right here. So, but yes,
Thank you.
we will get to a motion, believe me. All right, Councilor Jarrett.
I was about to make a motion, but I guess
all right.
Well, I'll just make it. It can always be withdrawn. Okay. I move that we refer this appointment to City Services.
Second.
Okay, so motion made by Councilor Jarrett and seconded by Councilor Foster. Councilor Jarrett, you have the floor.
Great, thank you. So I was reading section 210 of the charter, and as I read it, it says that each person the mayor desires to appoint as a department head or as a member of a multiple member body, but not including any position which is subject to the civil service law, that needs to be referred to the city council. And then the city council shall refer each name submitted to a standing committee of the council, which shall review each candidate for appointment and shall make a recommendation to the full city council not less than 7 nor more than 45 days after the referral. So my question is he a department, is Solicitor Seawall the department head, or is he subject to the civil service law? So just trying to clarify, are we required, because we can't suspend the charter, are we required by the charter to refer to City Services?
Excellent question.
I believe, and Alan, you'll correct me if I'm wrong, that you are considered a department head, is that right? I'm not sure the solicitor can unmute.
Oh, I'm so sorry.
Good evening. First of all, let me thank the mayor for those kind words, really, and I will echo those words. It really is meaningful to me to represent this community that I've lived in for 41 years, and I was honored when Mayor Narkowitz asked me to serve, and I'm honored that Mayor Shera has asked me again to serve. Obviously, I cannot counsel the council on my own appointment. That would be a conflict of interest. I have no concern about being referred to a committee. I don't. There are aspects of my appointment that are like a department head, but I don't have a department. I'm not an employee of the city, so I'm a little bit of fish and a little bit of fowl. And so my position has always been, I am happy for the council to handle this any way the councilors think is appropriate. And if it makes sense to you to treat me as a department head in this regard, makes perfect sense. However the council wants to hear it, I'm certainly willing to participate in whatever process you deem to be appropriate.
Thank you, Alan. Councilor Maori.
Yeah, so how have we handled reappointments in the past the same way as appointments? There's no difference in the way the city is historically handled.
I'm really the only thing that approximated department head who actually gets reappointed with a new administration. Other department heads don't get reappointed.
True, right. Well, I wasn't thinking of new administration, but yeah, I guess, yeah, right. Like they'd have to go away and come back for us to reappoint them, right? So you are unprecedented, or kind of.
And this is the first time this is coming before the council under the new charter.
Oh, okay.
Councilor Labarge.
Yes, I've worked with Attorney Seawall from the time that he became the city solicitor. And I've really enjoyed working with him. He's very knowledgeable and so forth like that. And very helpful. I can call him, talk with him, and get answers from him. And I just heard him say he didn't care how we were going to handle his appointment. So I would say I would refer this to city service. Let's get him there and let's do what we have to do and get him working under the mayor permanently.
Thank you, Councilor Labarge. Councilor Moulton.
Yeah, I think it's fine to send it off to city services. It's not really going to change the condition, and he's continuing to work as the interim city solicitor. I'm new to the council. I'm not new to working with Attorney Seawall. I worked with him very closely 3 years ago when he advised the Charter Review Committee. I found his advice invaluable, not only for his knowledge about municipal law and its intersection with state law, but also the way he delivered it. He was masterful at guiding us, but not restricting our mission. And I'm very pleased to support his reappointment.
Thank you, Councilor Moulton. Does anybody want to speak to the motion to refer to city services? Councilor Jerry.
Well, I did want to say that I've also had a great experience working with Solicitor Seawall. And I think given that we can't actually get his advice under my reading of the charter, I think that referring to city services seems like a great plan.
Okay, anybody else? Councilor Maori.
Yeah, I just want to confirm the responsiveness. It's really good when you're panicking and thinking about whether something might be legal or not, to have someone call you back right away. So always appreciate that. And yeah, thanks.
Okay, anybody else? Well, I just want to say to Attorney Seawald that if we had decided to appoint you tonight, I would gladly do that. I think adhering to the rules of the charter, even though it's not entirely clear, maybe a future revision is needed here. But I also ask that you not go to another city or town while we go through this procedure to make sure we adhere to the charter. So I'll be voting to refer as well, but really appreciate it. Councilor Maori mentioned responsiveness. It's really quite remarkable, and good advice like that. So okay, so Pam, could you take the roll?
Absolutely. Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Foster, excuse me, Counselor Elkins,
Yes.
Counselor Foster.
Yes.
Thank you.
Okay.
Thank
That
you all.
is referred to city services. Counselor Maori?
Yeah, I guess a point of order, a point of something. I was just going to ask that if we could repeat the motions right before we vote. I think we all knew, but I think, a new council, it's never.
That's fair. Thank you.
Okay, yeah.
Yeah. Okay. We are now moving on to the consent agenda. I just want to take a quick moment to thank Pam Powers for being here tonight. We and the mayor's office for the work that they did to help pull together the agenda and the staffing for this meeting. It was really quite remarkable and was really needed for our to support our administrative assistant at this time. So anyway, yeah, there was a lot of behind the scenes organizing, and I'm really grateful for that. So, and we have Pam here who's been through many of these meetings. So, okay, on to the consent agenda. I'm just going to read the items, and that counselors can request a removal for further discussion. If you don't request for removal, all of these items will be voted on together. So let me read through them. Item A, minutes of the January 3rd organizational meeting and the January 6th city council meeting. Item B, 22006, in order to authorize the fire department to accept gifts of tangible personal property. Item C, 22.007, in order to reprogram funds for central services projects. D, item 22008, in order to appropriate free cash to NPS for federal foster care transportation reimbursement. E, 22.009, in order to appropriate free cash to NPS for McKinney-Vento transportation reimbursement. F, 22.010, in order to appropriate free cash for furniture and acoustical panels. G, 22.111, in order to appropriate 1.5 million free cash to various stabilization accounts. H, 22.017, application for business owner's permit for Charles Bando Akifi Hampton Taxi Services LLC. I, 22.018, application for one taxi cab license for Charles Bando Akifi at Hampton Taxi Services LLC. J, 22.020, appointments to boards and committees and commissions for referral to city services. There's a little typo there. Garrett Williams to go to the Arts Council, Kelsey Flynn for the Parks and Recreation Commission, Chris Tate for the Planning Board, and Jacob Dissinger for Trust Fund Committee.
Move to approve.
Second.
Any removals? Okay, no removals. It's been a motion and seconded. Pam, can you take the roll call?
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Elkins,
Yes.
Counselor Foster,
Yes.
Counselor Gore.
Yes.
Thank you.
Okay, the consent agenda passes unanimously. Okay, we have, now we're up to 10 financial orders. We have item A, which is 22.016, in order to authorize a 5-year contract for IT services, department equipment, and software. So just to review the rules for what we're doing here, financial orders will be introduced and discussed at the full city council meeting and referred to either the consent agenda of a future meeting or the finance committee for more public input, discussion, and recommendation. So for this item, I'd like to recognize Mayor Antonio Pagan. He can speak to this.
Yes, our IT director, Antonio Pagan, is here to speak to this. I'm guessing that he cannot unmute.
Yeah, okay. Let's see. Name. Let's try that. Let's see.
What about now?
There we go.
Okay. Good evening, everyone. Welcome to the new councilors, and thank you for having the opportunity here. So we normally do 3 years contracts for equipment and software and support. In this occasion, the opportunity for getting this system and support is much better if we have a 5-year contract. So after reviewing several proposals, we decided to move forward with a 5-year contract, and that's why we're here today. So basically, this is a proposal for getting a replacement of the in-car video systems for police department. Originally, we presented this to the Capital Improvement Program subcommittee, and it was in the process of being considered. We were thinking about buying the equipment and getting a 3 years contract for support. But after looking at the several proposals that we received from different companies, we saw a better opportunity to have a 5-year contract with this company, which is Motorola Solutions, and getting better services and more flexibility for the PD employees to use the system. And basically, we get not only the cloud-based software, but we get all the equipment. We get service and support for the equipment and the software. And we got equipment refreshes and replacement out of the same contract.
Thank you. I see Councilor Labarge has a question.
Yes. Thank you, Antonio, for being here. The question I have is, what is the cost and how much are we saving versus what we had before?
Sure. And I'm going to answer the question, but let me give you a little bit of background information here. So the current system that we have had for more than 8 years is really unreliable. We are having some issues. We've been, as you might know, the IT services department took responsibility for public safety in 2018. And since that day, we've been working with the manufacturer of the current equipment, and it's been really difficult to really get a reliable response from them. When we did the procurement for this, we actually look at several aspects of the system, not only the cost, but reliability, services, and flexibility for the staff to work with the system. The current system is being, it has caused a lot of problems to the police department, where in some cases, they haven't been able to reproduce the video evidence that they need. And that is really critical for the department. So that I can share with you the different vendors that we look at. We actually work since 2019 until 2020, basically, with the current company trying to get a better response, but all our efforts were really fruitless. We couldn't get the response. We paid a lot of money to them to come here in person and trying to fix the issues. And it would be fixed for a few days, and then it will have problems again. So we look at 3 other systems that are used, in the whole nation and in the Northeast. And we look at Motorola Solutions, which, by the way, they bought a system that we used to have before, which is WashCard, and they have enhanced the services a lot since they bought it. I can show you. I think it would be better if I can present the presentation that we did for the police department, and I can show you what were our thinking for making that decision to go with Motorola. It's more than cost, even though the cost is always one of the primary rationale for decisions, but it was more the reliability and the services that they provide.
So you have some documents you'd like to share your screen?
Yeah, let me just this process took us several months, and I can show you. It would be better if I just put a PowerPoint that we share with the police department. We went after we did the process. Let me just go back here. There you go. Can you see my screen there?
Yes.
Okay. So this is basically what we presented. We got a lot of issues, but basically the main issues we have was loss of connectivity, because it relies on wireless to upload the videos. The functionality and operations were really random, like a car could be working today and then next day will stop working. Moving the systems from one cruiser to another was really difficult, and integrity of the data was really not there. So we basically were asked by police chief to look into solutions last spring, and we went into a process of basically just creating some specifications for the system. So we look at hardware, reliability, evidence management, which is a major issue that we have, capabilities of the company for doing implementation and training, and the support, obviously, and cost. After looking at several options, we got demos from Motorola Solutions, Exxon, and GTAG, all of them being used in Massachusetts and other communities around us. And basically, we just created a system for rating each one of the proposals. And we weighted the different categories of scoring for the proposals, giving more weight to the reliability, the support, and the cost. So basically that brought us to, and this is where we got some very good advice from Motorola, which was, we had two different options with them. We could get one system that we purchased equipment and that would give us a support for 3 years, or we could get the subscription of a cloud-based system that would be basically, we will be paying for the services, but they will basically just, instead of us owing the equipment, we will be just getting the equipment as part of the subscription. If it's something went wrong, it will be replaced without questions. On using our rubric for evaluation, so we got the points. The first option of WashGuard solution was on premise on 3 years contract, and the second one was cloud-based with a subscription for 5 years. As you can see, their system was, more aligned with our needs. And even though the cost was not very different, we got a lot of advantages in terms of the kind of evidence management that we could do. One of the things that we will have with this system is the officers in the police department will be able to redact online without having to move the video from one system to another, which is what we do now if we have to do it. And they can get collaboration among them before they present to any case that they're working with. So it's a much flexible system. Our cost is not a lot bigger. It's basically comparable. And we have something that is reliable and is used by many communities. And it's a product that has been on the market for many years. So that is basically what we use for evaluating the systems and how we made the decision to go forward with this 5-year contract.
Right. And I can see where you've made that decision with the difficulties you had with what we have now, and here and what you're going to get, the support which you need and the maintenance.
We will, definitely we will. We actually contacted municipalities that have the system right now, Amherst being one of them, and they are really pleased with the services from WashGuard, which is basically the division of Motorola Solutions that we are contracted with.
Thank you so much, Antonio.
You are very welcome.
Councillor Elkins.
Thank you also, Antonio, for your presentation and discussing this. You mentioned something about redaction on the, I didn't quite understand. I didn't catch what you said, the services.
When the video is captured, sometimes you have to basically trim the video clip that is captioned. These systems, basically what they do is they act on alarms. So they start recording at a specific time. And basically there might be a need for using some, tools to basically zoom in some areas to get some information to be presented, or they might be able to mark up some specific evidence in the video. So that is a different tool. That's not part of the system normally. The system that we have now doesn't have that. We have to basically export the video out, and the officer has to work with some video editing to make those remarks there. In this system, everything is integrated.
Okay, thank you.
Yeah.
Councilor Maori.
Of course, my internet went out right when Antonio gave the answer to Councilor Elkins' question, so I'm not sure if it was covered, but are you talking about surveillance camera? What kind of medium are you talking about for the police?
No, these are dashboard cameras that are on the cruisers.
Dashboard, okay.
Yeah,
I just didn't
dashboard
understand what
cameras
type of.
Yeah, they've been used for many years in Northampton. Yes.
Okay, thank you.
Sure.
I didn't have.
I see Councilor Maori raising her
Yes.
hand again.
I have so many questions. Yeah, well, I actually had another question, which was, so if the 5-year contract, how is the payment done for that? Is it kind of, you pay all at once, or you pay each year? What does that look like?
It's an annual payment. What happened was we were planning to do, when we started the whole process of replacement, because we normally don't use capital improvement money for this, but that was, was a need because of the situation that we are having with the current vendor. We decided that we were basically just transfer some funds to buy cameras for, I think it was, we were talking about four cruisers, and pay basically $50,000 to start this year. And then we went to capital improvement to get another $60,000 for next year to include the rest of the cruisers and replace the whole system together. When we saw this opportunity to do a 5-year contract, we agree with the organization that they, or they agree with us that we could pay the $49,000 that we have available now, and then pay basically, I think it's $21,000 per year for the rest of the time.
Thank you.
You're very welcome. And just let me just add to that basically this is in line in when we discuss this with capital improvement, this is in line with what we're trying to do with all the IT equipment, that instead of being using capital improvement money for getting IT equipment, we basically get operating budget money. And this way we can really budget an annual payment. And that's what we're going to be doing in this case.
Councilor Perry.
Yes. So I have a question about kind of the installation of these systems. What is the kind of the time frame on that? And will there be a period where there aren't cameras, or is it just, you take things off and immediately they'll be replaced?
Very, very good question. We are planning to have both systems running at the same time. So we will be replacing, we haven't done a timeline because we don't have a contract yet, but basically we would be negotiating with them a timeline where we'll be installing. It takes basically half a day, like 4 hours, 4.5 hours to install every system on the current system. So I would imagine that with the new system would be something similar. So most likely they would come here for 2 or 3 days and do a few cruisers installations. We will continue having the old system in place because we have to, as we put in place this one. And then we will be rotating until we have all of them replaced. So there will not be any cruiser that will be without service during the time of installation.
Councilor Elkins.
I just wanted to, and then I immediately dropped my pen. I wanted to, I wanted to add and share with other counselors from my perspective as a defense attorney, how incredibly important this facet of evidence gathering is to the police function. In in terms of accountability and in terms of their obligations to provide due process and make evidence available that's going to be used against people in prosecutions. I can say from experience that Northampton PD has always been among the leaders in adopting dash cam technology and being much more forthcoming with this kind of evidence, where other local jurisdictions have not always been. I think there's some that still to this day don't have dash cam evidence and use this kind of technology, and it's because they don't want it. They don't want the transparency, and they don't want to have to be accountable and answerable. So just to the extent the details of what is technologically the best thing to use, I certainly leave that to the experts and their good service to the city. But I would have to emphasize that I think that this is a very important expenditure for the city to take on, and I'm not sure if we're talking about then sending this to finance, or this is my opportunity to say that this is something that I think that we ought to support and make sure that gets taken care of. But if it's not the right time, I'll say it again when it is the right time. But this is I would like to say that.
Thank you.
Thank you. Anyone else? I don't think we have a motion yet. We've had discussion. Councillor Labarge.
Yes, I'd like to make a motion to refer this to the consent agenda.
Second.
Okay, motion made by Councillor Labarge, seconded by Councillor Jarrett to send this item to the consent agenda. Any further discussion? I would just like to say that I really appreciated the presentation. I also very much appreciated Councillor Elkins' take on things as somebody who's been part of the legal system, and that yes, that this increases accountability for our officers, and I think this is a great way to support them to provide this equipment that really helps keep things accountable. So motion on the table to refer this to the consent agenda. I think any more discussion? Okay, Pam, can we get a roll call?
Absolutely. Councilor Labarge.
Yes.
Councilor Maori.
Yes.
Councilor Moulton.
Yes.
Councilor Nash.
Yes.
Councilor Perry.
Yes.
Councilor Elkins.
Yes.
Councilor Foster.
Yes.
Councilor Gore.
Yes.
Councilor Jarrett.
Yes.
Okay. That is referred to the consent agenda. Okay, next up, under financial orders, B 22.012, in order to grant utility easement to National Grid for 54 Clark Street well. Let's see, the order. Mayor, is there somebody here to speak to this order?
In fact, Director Lascalia is here to speak.
Yeah, I think it would be better just to let the director speak to this rather than hear me read an order.
I thank her for joining us, and
yeah,
I'm happy to defer to her.
Let's see, can we make a co-host? Director Lascalia.
Okay. Thank you, Council President. Good evening to the council, and welcome to the new councilors. For those who don't know me, I'm Donna Lascalia. I'm the Director of Public Works. So thanks for the opportunity to speak tonight. So the city operates 2 drinking water wells. One of them is on Clark Street, and National Grid approached us a couple of months ago because the utility feed, the electrical utility distribution that provides power to this well, actually runs through the woods. It runs through the right of way like sort of a heavily wooded, inaccessible area in the rear of the structure that supports the well. And this was actually a National Grid initiated project where they would like to bring the feed to this well, the electrical feed to this well, out to the road so they can actually access it if something were to happen, like during a storm event. So obviously the reliability of our pumps for critical infrastructure like this is very important to all of us. So we wholeheartedly support this. The National Grid proposes to install poles along the driveway leading into the well and its appurtenant structure, which would be easily accessible, by any trucks in a storm. If the wires were to fall down because a tree hit them or a pole broke or whatever the case may be. So right now it's definitely an off-road situation if something happens to that electrical feed, and that could certainly delay getting the power back on, which makes our life more difficult in a disaster situation. So the easement is so that National Grid can actually set poles on city property. So that's the purpose of this order, and DPW wholeheartedly supports this. Thank you.
Councillor Labarge.
Yes, Donna, it was great talking with you the other day. And I know I have a lot of knowledge about, Clark Street. I know every house on that street. I even told you about pole 7, which I felt that it looked like a brand new pole down there now, but the road was terrible. But yes, we're in dire need. There's no question about it. And I really support this. It's in dire need. And knowing that because it's such a small road and the houses are pretty well close with each other, and we have one last house on the end, I was a little bit concerned about them coming in and working and having those big trucks, and knowing from you that, no, that's not going to happen. They're going to be inside the property where, you're coming in through that dirt road and that. So I'm pleased about that. But are the residents going to be notified of that area, that there will be work down there by Verizon?
It's actually National Grid who will be setting the
National
poles.
Grid, right.
Yeah, it's unclear to me what their notification procedures are. I will have to issue National Grid a trench permit. They actually can't excavate, within the public right of way without a permit issued by my department. So what I can do is just ask them to give me a schedule, as a condition when I issue the permit. I can just ask them to give me a schedule, and I can let you know when they're going to be in the area. I can't speak for their operations and sort of describe how their trucks might be set up when they're trying to do this work, but generally they allow for the safe passage of traffic, or they have a police detail present to control traffic if one is needed.
And at least we know, I know now that the trucks are not going to be on that road. They're going to be inside private property, correct? That's where they're going to be putting the poles.
Right, the poles are going to be set on the driveway leading into the structure. Now they do have to put a push brace on pole number 7, so they will have to set up right at the edge of the driveway. So
Right.
Again, I can't speak for their operation. They may actually have to set up in that road for a time. But I can certainly clarify that with them when it's time to actually do the job.
All right, thank you, Donna.
Thank you.
Director LaScalia, I have a question. And that National Grid is doing this at no cost to the city?
Yes, no cost.
Yeah, there's no cost. They approached us, which likely has to do with reliability for critical infrastructure. So there are, a lot of our facilities have been identified as sort of essential facilities that are earmarked for priority restoration in the event of a disaster, and where this is a drinking water facility, this would be top of the list. So I don't want to speak for National Grid, but I would imagine, in assessing facilities in the area and looking at the current power feed coming into the building through the woods, this was sort of low-hanging fruit for them.
Thank you. Okay, we've had some discussion. I don't think we have a motion yet.
Yes, I'd like to make a motion to refer this to the consent agenda.
I'll second.
Okay, motion made by Councillor Labarge and seconded by Councillor Moulton to send to the consent agenda. Any discussion on the motion? Okay, seeing no discussion, Pam, roll call, please.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Elkins,
Yes.
Counselor Foster,
Yes.
Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge.
Yes.
Thank you.
Okay, that motion, the 22.012 has been sent to the consent agenda for our next meeting. Now we're up to C, 22.013, in order to accept a gift of historic marker honoring Sojourner Truth.
Counselor Nash,
Yes,
could I request a 5-minute recess?
Thank you.
sure. Why don't we let's take an 8-minute recess.
Thank you, President.
And so we'll be back at 9:13.
Thank you.
Thank you.
Okay, we're back to, Dave, are we back on the air? Okay. Thank you. All right, we're back to item 22.013 in order to accept gift of historic marker honoring Sojourner Truth. Process note, suspension of rule 5.5 requiring that a measure must first have been introduced at prior city council meeting before a vote may be held, and rule 2.6.1.1.1, Marissa, you're going to change that sometime, right? Is respectfully requested to meet the grant program's deadline for gift acceptance by July 31st. So I think they're asking we vote on this tonight. Is that correct, Mayor?
Yes, please.
Okay. All right. And is there someone to speak to this marker, or should I just be, you want to hear me read?
You're welcome to read. I can speak to it. Director LaScalia can also speak to it.
Okay. That's it. That's always better.
Okay. I'll just start. I will defer to Director Scalia, but I just want to start and express some gratitude and just say that, of course, the Sojourner Truth Memorial Park is such an important space in Florence and part of our history. And I'm just very grateful to the Pomeroy Foundation for this generous gift of a historical marker. And I thank the Sojourner Truth Memorial Committee of Florence and Suffrage 100 MA for helping to make this happen.
Okay.
Okay, and I can add a few words here. So I've been working with the Sojourner Truth Memorial Committee and an organization called Suffrage 100 MA to facilitate the installation of a trail marker at the Sojourner Truth statue in Florence. I think it would be helpful to read a brief statement by Carol Reinhardt, who's actually on the call tonight, who's the co-chair of the Sojourner Truth Memorial Committee. She writes that it is our mission to keep alive the history of Sojourner's work in our community, as well as foster her vision of a world of equality and justice for all people. The committee submitted an application to the Pomeroy Foundation to be one of 5 historic markers in each state on their National Votes for Women Trail, which is made up of roadside markers throughout the country commemorating suffragists and suffrage activities. Pomeroy reached out to a nonprofit called Suffrage 100 MA to assist with establishing the 5 Massachusetts markers. The Sojourner Truth statue in Northampton has been improved for inclusion. And I will add, again, these are Carol Reinhardt's words. It is important to state that our committee understands that the long process of achieving women's suffrage was painful for women of color, and both the process and the result fell far short in its failure to secure the right to vote for all citizens throughout the nation, not just white citizens. Laws to protect those rights did not come until the passage of the Voting Rights Act of 1965. This is one of the reasons this marker is so important, because it keeps awareness of this reality from being neglected. Now more than ever, her statute calls for truths and passionate voice that called not only for the abolition of slavery, but for total equality and voting rights for all citizens. So I will add that present on the call tonight are Freddie Kay, who's the founder and president of Suffrage 100 MA and the state coordinator for Massachusetts for the National Votes for Women's Trail, Carol Reinhardt, whose words I just read, Wendy Sinton, who's a member of the Sojourner Truth Memorial Committee and one of the people who submitted the original application, and Peter Ives, who's the treasurer of the Sojourner Truth Committee. So this has been a wonderful collaborative effort by a very large group of people who also appeared before the Historical Commission, and the Historical Commission is in fact a co-sponsor of the order in front of you tonight. So I will add that if council were to approve this gift, the DPW will take receipt of the trail marker on behalf of the city, and we will work to install it. And this will actually be one of 5 markers within the state, all at other historically significant locations, and actually creates a nationwide network, a nationwide trail network that folks can actually sort of follow on their smartphone. And it's actually it's a really great project, and I'm very grateful to all the people who came together to make this possible.
Thank you. I'm going to refrain from speaking first. but I'm inspired to speak. Counselors, any questions, thoughts on this? Counselor Gore.
I just want to commend the Sojourner Truth Memorial Committee and everybody who worked on this. I think it's a great gift for the city to have, and for such a historic marker that we have here in Northampton is really important to honor it with this gift. So I really appreciate everybody who worked on this.
Thank you, Counselor Gore. Counselor Labarge. I think you're muted.
Sorry about that.
There you go.
I'm so happy about this. When the group had worked tirelessly about raising money to put up the statue of Sojourner Truth, you look at that, I go by that every day to go up to the center of Florence, and it's just absolutely beautiful, beautiful. And I want to say that here, the Pomeroy Foundation, of what they're doing and donating $5,000 to make this happen. And we have the Department of Public Works who is stepping in and helping to designate where the marker is going to go and so forth. I think this is just wonderful, wonderful for our community. I think it's an educational purpose here of that statue. I mean, even with my granddaughter, she'll be 18 in February. When the book came out of Sojourner Truth, and we were down on Main Street, and I think our mayor now, she was there too with the new books that came out. And I actually sent one to my granddaughter and said, you keep this, because once you go to college, this is very educational, and you can do a report from it, where your grandparents live. And I'm honored with this statue. And I am so happy about this, well deserved.
Thank you, Counselor. Okay, anybody else? I think we need a motion, our first motion to suspend the rule.
I'll make a motion to suspend the rule.
I'd second that.
And just to be clear, we're suspending the rule, our rules, which is to either send it to the consent agenda or to refer to Finance Committee. And we are then going to vote on this tonight. So I'm sorry, I didn't track where the motions were. Who made the motion?
Motion's gonna go, I did.
Okay, and the second was Councillor Elkins. Okay.
Yeah.
All right. Any more discussion? Roll call, Pam.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Elkins,
Yes.
Counselor Foster,
Yes.
Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori.
Yes.
Okay. The rule for referral has been suspended, and that now we need a motion to approve this tonight.
I'll make a motion to do that.
Okay. Counselor Perry made the motion to
Second.
approve, and then second by Counselor Gore.
Gore, yeah.
Excellent. Okay. Any discussion on approving this tonight? Seeing no discussion, Pam, roll call, please.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Elkins,
Enthusiastically, yes.
Counselor Foster,
Yes.
Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton.
Yes.
Okay, excellent. That passed, and we are going to accept that gift. And DPW is going to install it.
Yes.
So Counselor Nash, may I interject for 1 second? I'm just
Yeah, go right ahead.
trying to understand the new rules. So you only need one reading, is that correct? Okay,
Yeah.
great. Thank you.
Always good to ask. We're all asking it as we do this. Okay, now we're up to 22.014, in order to accept a gift for replacing sidewalk sections adjacent to 109 Main Street. For counselors who have been on council before, this will look familiar. And anyway, Mayor, is there somebody, is Director LaScalia going to speak to this?
She absolutely can. And I just, this is an evening of gratitude for me. I just also want to express gratitude for this as well to Trident Realty for this gift to help make this section of sidewalk safe and accessible. But Director LaScalia can speak to it in more detail.
Great.
Yes, yeah. So for those who were on the council last term, this section of sidewalk may look familiar. The order that is back before you is actually for the same section of sidewalk. The order is written in a way to reflect the changing project. So initially when this started, there's sort of this no man's land area of sidewalk where the ownership is unclear in front of 109 Main Street. So initially the owners of 109 Main Street approached us and were going to do a discrete project on their own to fix this sidewalk. And that was the order that came before council last term. What happened was the project sort of turned into a little bit more complex just based on the grades of the sidewalk. There were a lot of sort of strange transitions in front of that building for counselors who may be familiar with the lay of the land there. The grades are very, very difficult. And in order to make that area handicap compliant, it actually turned into a little bit bigger of a project, which ended up being folded into a larger city project to make improvements elsewhere in the city. So we often do things like this where we group projects together just so we can have some economy in bid prices. So what we ended up doing was taking this project over from the owners of 109 Main Street and incorporating it into a city project. So instead of 109 Main Street actually managing the work, the city will be managing this work as part of another project. So we are accepting a financial gift instead of a gift of the actual labor and materials, which is what the first order allowed. So we had to rewrite the order just to reflect current conditions. And I think that included with the order was a graphic representation of the area in question here. And when the job is done, the entire area will be accessible. It will be, ramps on either side, so that folks who have mobility issues can easily move through the area. And that is certainly not the case right now.
Pam, do you think you could pull up that diagram? Maybe one of the other, oh, there we go. You are good, Pam.
I'm sorry. I'm using a smaller computer and it's not allowing me to get up to the,
This is a window into your life, Pam. I can see it's very complex.
That was cool.
I feel intimidated by your tabs.
Okay, here we go. Nope, that's not it. Okay. Just give me 1 second here. Sorry.
Pam, I could give it a try.
Absolutely.
Okay. Can you stop sharing and I'll try?
Yep. There you go. Sorry.
Okay. Okay.
We're trying, Mayor.
Can you see it?
Yep.
Yes. So this is the sidewalk in front of, what's the business there? Or it's
Trident Realty.
okay. Yeah, and so Director LaScalia, I can see that the project has been expanded. that I recall it was just the narrow pathway, and now the project is widened to include the approaches on either side of that sidewalk. And I'm really pleased that it's now going to be an accessible sidewalk. There was it's almost like in a trough there, that particular sidewalk. And so yeah, I think this is terrific.
Yeah, the footprint of the area actually had to be expanded because we could not get compliant grades, so we had to keep pushing out, and that's why this area is actually much larger than was originally intended.
Okay. I think we're done looking at this. Councillor Labarge.
Yes, thank you. I am very pleased, especially with the handicapped accessible and dire need in that area. I like the plans. I also think when I talked with Wayne Biden this week, I asked him about what it would actually cost to redo this over. And he said between the 7,500 and I think with the city itself, you're looking at 20-something thousand. So we are saving money here, but we're looking at our community and many, many people who are handicapped and accessible and need this done. So I think this is great. And thank you, DPW, for working tirelessly on this also.
Councilors, any other questions? Okay, Councilor Jarrett.
Move referral to the consent agenda.
Second.
Okay, motion made by Councilor Jarrett, seconded by Councilor Moulton to send this to the consent agenda. Any discussion on the motion? Seeing no discussion, Pam, roll call, please.
Counselor Perry,
Yes.
Counselor Elkins,
Yes.
Counselor Foster,
Yes.
Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash.
Yes. Okay, that passes and will be on the consent agenda at our next meeting. We are now up to orders. We have item 22.019, in order temporarily suspending the effect of certain ordinances in response to efforts to support renewed economic recovery efforts in compliance with the requirements of COVID safe social distancing. Mayor, who's here to speak to this?
I am, and
Okay, go for it.
yeah, and I hope that actually counselors did have a chance to read over the order. Returning counselors will remember similar orders in the last term, though this one looks a bit different because I asked for more explanation and sort of fuller context to the order. You heard from Amy Kaling in public comment about this, as we're in this current surge and our restaurants are really struggling, even amidst this moment of struggle for them, they are looking to the future and they're dreaming of spring and when we can again have outdoor dining. And we know that the efforts the city and the businesses made last year to mobilize outdoor dining and the absolute massive success that Summer on Strong was made a huge difference for businesses. And as you heard, many said really made the difference between their survival as a business or not. So we are already having meetings and businesses are deep in planning on for Summer on Strong, and we are just thinking creatively about other spaces downtown and in Florence, and that can be used for outdoor dining and for outdoor experiences to support all of our downtown businesses. So this order allows the flexibility to make those plans, which, as I said, businesses are already really focused on as they look to a warmer future to help them stay in business.
Thank you, Mayor. Any questions for the mayor? Councilor Jarrett.
Thank you. I wanted if you could, so the definition of the COVID-19 restaurant response zones, I didn't see a plan entitled that, which is referred to, but are those the highlighted districts on the maps?
Yeah, they are. Let me seeing if whether I could pull them. Oh, it looks like Pam's on it. Yes, they're the highlighted districts that are on the maps.
Yep.
Great. Last year we had Summer on Strong. Would this allow something like that? The closure of an entire or a section of street, or would that have to be a separate order?
I believe that this would allow that, which is one of the reasons why we're starting, we're bringing this to you right now, is that the planning for that is already underway, and those businesses in that area are really interested in doing it again. And the city is talking about partnering in sort of additional ways to use that space. And, one of the things that's really important to me is that there is sort of open use for the public in any of these public spaces that we're using in this way.
Great, yeah. I strongly support this. I think it's been a great success, and I love the use of the street for this purpose. So that's great. I did have a process note about orders. This talks about notwithstanding a city council order to the contrary, something like that, some language like that. Do the orders always come from the mayor, or not that I anticipate doing this, but could the city council put forward an order to rescind it or modify it in some way? Does anyone know the answer to that process-wise?
We lost the city solicitor who was here earlier.
Yeah.
Would be the best person to answer that. And one thing I should have pointed out, which is in the order, is that come like the previous orders, no further action will be needed to rescind this order, and that it turns into a pumpkin in the fall and lapses and completely converts back in November as the other ones did, which is why we're not operating under them right now.
Mm-hmm. Right. Great. Yeah. Well, we since this is just this will require a second reading under our rules, I believe. So we will have time to get that question answered, and in 2 weeks can do the actual vote on it. That's my understanding. Thank you.
Thank you.
So Councilor Jarrett, so that a motion here will be to refer it to the consent agenda for our next meeting, or?
I don't think so. I don't think we have to take any action. We could refer it to a committee if we wish, but it's only financial orders that are referred to either the finance or the consent agenda. It would rather be just show up on our next meeting, and we would, as a second reading, and that's the one where we would actually vote on it.
Okay, all right. Thank you for clarifying.
Councilor Nash, I saw some hands.
Yeah, okay. Thank you. Let's see those hands again. Okay. Councilor Maori.
I just feel compelled to channel Councilor Dwight for a second and just say, I can just hear his voice saying, we should definitely need to remember that roads and sidewalks, these are public spaces, and we need to hand them over thoughtfully. And of course, this is a very thoughtful way to do so. But I just had to mention Bill for a second because that made an impression on me at the time.
Thank you, Councilor Maori. He is always in my head as well, or actually talking to me. And, that's one of the reasons why I wanted to really just say that already in these discussions, I've expressed that it's of utmost importance that we remember that this is public space and that it needs to be open to the general public as well.
Councillor Foster.
I just wanted to echo Councillor Dwight. He's like got this like little part of my brain discussing that as well. But also just to say, thinking about that it's a way that in the last warm season we were able to really support many businesses who I know are struggling. I believe in the last week and a half or so, it looks like 3 or 4, stalwart businesses of Main Street are not able to continue. And we also know that the businesses are a beating heart of downtown and of downtown Florence, and support our community in so many ways. And this is a way that we as a council can support them. And then also keeping in mind the public space. And it was really exciting. Summer on Strong was a really exciting way of reclaiming public space for people instead of cars. And that was pretty fantastic. And more than once, I walked through with my family on nights that we weren't getting dinner or drinks, but just to be there. My boys loved walking through that the pedestrian zone, and it was really welcoming and inviting. And the more we can encourage those kinds of spaces, the more connected we as a community are, both to each other and to the businesses that are located along there. So it's definitely something I look forward to supporting when this comes up for vote at the next meeting.
Councillor Labarge.
Yes, I really care about this order that's come in. And as city councilors, it is our job to help our businesses get back on their feet and strive. I would like to really refer this order to the consent agenda. I think it is our responsibility to help all the businesses. We lost many businesses. Let's help strengthen our city of Northampton and help our businesses. They're in dire need of the support and help. And just like Councillor Foster mentioned about coming down with her children and so forth, we want to keep that and keep that feeling of knowing that how much our businesses mean to all of us councilors and everybody in the community. So I think this is critical here. And I want to thank our mayor for coming forth with this and helping all our businesses to try to strive and come through this terrible pandemic that we're into. This is not an easy job for our mayor or our city councilors, but it is our responsibility to follow our mayor to help our businesses in dire support. Thank you.
Thank you, Councillor Labarge. Councillor Perry.
Yes, I want to echo what a lot of people are saying. And first, thank the mayor for bringing this up and being forward thinking. As a very long member of the service industry and entertainment industry, I could attest to you firsthand how important it was to have things like Summer on Strong, not only for the businesses and for the people, but also for artists. And I want to state that Northampton has been built off of artistry, music and things like that. And so I think that putting this forward now is a good and timely thing, because the last Summer on Strong, while it was excellent, could have used a little more time to be discussed and planned. And so hopefully I will offer my services as a member of that community to help in any way I can, because I think it is important, because it re-inspired me to see what Northampton can be. So thank you.
Thank you, Councillor Perry. And yes, I think, we've learned a lot from last year, and it's exciting to sort of get started earlier and be able to plan.
Okay. Yeah, being council president, I'm in this weird position of being the last to speak. And the mayor's familiar with this. So I just want to say how much I appreciate the proactive forward thinking of the mayor's office on this. This is really good for the businesses. They can plan ahead. They can buy the street furniture, any of the equipment. They can really be proactive in setting up for a successful business in better weather, and during this pandemic, the opportunity to be outside, it really is the place where we can get back to thriving again. So kudos to the mayor's department for being proactive here. And so on that,
I just ask a process note. Thank you very much for those kind words, Councilor Nash, and I agree. I do want to thank the staff in the mayor's office who who did so much work last year and are so proactive about this and really engaged with making this for doing all that we can to support our businesses. Sorry, that was a long preamble to what I said was a process question. So for orders, I don't see this on the agenda for referral. Can you take a vote? Would you need to suspend the rules to vote on it this evening? I'm not sure where it fits on your agenda.
What is the pleasure of council?
I'd like to suspend the rule and go ahead and do the voting on this so that they can start right off in the city, the business people, and order their furniture and do whatever they have to do to organize.
That sounded like a motion.
Another 2 more weeks here.
I will second that.
But do we need to suspend the rules? Okay, thank you, Karen.
So this is the fun of new rules. Okay, I saw Councilor Jarrett's hand go up. I think we do have a motion on the floor. It's made Councilor Labarge, seconded by Councilor Perry. Councilor Jarrett.
Yeah, so Rule 5.5, matters requiring 2 readings. It says, before a vote on the matter may be held, it must first have been introduced at a prior city council meeting, unless otherwise provided in these rules. The next one, Rule 5.6, matters requiring 1 reading, lists all of the types of matters that only require 1 reading, and orders, except special ones about adopting or amending the council rules or setting the dates and times of council meetings, are not in that list. So we would need to suspend Rule 5.5.
Exactly.
Thank you, Councilor. So we have a motion on the floor to suspend the rules. Any discussion? Councilor Foster.
Yeah, that was the clarification. That yes, that the way the rules are written, it would appear on the next agenda for a vote. And so I guess it's a question for the mayor is that something that the mayor's office would request would be a suspension of rules so that the businesses have the extra 2 weeks to plan, or is there not an urgency to that?
I mean, certainly if the council was willing to do it, I know that the businesses would greatly appreciate it. But we'll defer to what the council would like.
Councilor Jarrett.
Yeah, I am fine with suspending these rules and doing this now. And I understand usually I do like to see a note on there so that I know to do the extra work to make sure I'm ready to vote on it. But I understand that, these rules are new. It wasn't necessarily understood that it would be that normally we would have 2 readings. So I'm also fine with going with this tonight.
Thank you, Councilor.
Anyone else? Okay, Councilor Jarrett, I just wanted to say to your point that in terms of the details, my hope is to have those things embedded in the agenda and have things clear. What you're seeing in the agenda is folks stepping up to paste together an agenda with without Laura here this week. So anyway, okay, so we have a motion and Pam, I saw you raise your hand.
Counselor Nash, I didn't get who made the motion and who seconded it.
I think it was Counselor Labarge made the motion. I think it was seconded by Counselor Perry, and this is to suspend the rule.
Yes.
Okay. Suspend
Okay,
rule
any more
5.5.
discussion? Okay, roll call, please.
Counselor Elkins,
Yes.
Counselor Foster,
Yes.
Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry.
Yes.
Thank you.
Okay, the rule has been suspended. Is there a motion to pass this tonight?
I'll make the motion to pass it.
Second.
Okay, motion made by Counselor Perry and seconded by Counselor Moulton.
I'll defer to Council Labarge.
Okay, Counselor Labarge. Okay, any discussion on the motion to approve 22.019 tonight? Okay, I see no further discussion. Pam, take a roll call, please.
Counselor Foster,
Yes.
Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Elkins.
Yes.
Thank you.
Okay. Okay, that order passes. Okay, now we're on to ordinances. These ordinances have been to the legislative matters, and they're now back here at council for second reading. The first order is 22.003, an ordinance relative to parking areas reserved for municipal use. This is the second reading where we vote on it.
Move to approve.
Could I get a second?
Second.
Okay, motion was made by Counselor Labarge. I believe it was seconded by Counselor Jarrett. Any discussion? Okay, roll call, Pam.
Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Elkins,
Yes.
Counselor Foster.
Yes.
Okay. 22.003 passes. Now we're on to item 22.004, an ordinance relative to prohibited U-turns.
Move approval.
Second.
Okay, motion made by Counselor Foster, seconded by Counselor Moulton. Any discussion? I just want to thank the DPW for answering questions relative to this this item and for all their work on it. Pam, roll call.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Elkins,
Yes.
Counselor Foster,
Yes.
Counselor Gore.
Yes.
Thank you.
Okay. That passes. Now on to 22.005, an ordinance relative to off-street service areas.
Move to approve.
Second.
Motion made by Counselor Labarge, seconded by Counselor Maori. Any discussion? Okay, I would just like to again do a quick shout out to Nancy Forrestal for her work on this and the aforementioned parking area. She provided really useful information for us. Okay, seeing no further discussion, roll call, please, Pam.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton,
Yes.
Counselor Nash,
Yes.
Counselor Perry? Counselor Perry?
Oh, wait, there you go, yes.
Thank you. Counselor Elkins?
Yes.
Counselor Foster?
Yes.
Counselor Gore?
Yes.
Counselor Jarrett?
Yes.
Thank you.
Okay, great. Okay, that brings us to resolutions, which it's unusual seeing it resolutions so far down on the agenda, but here it is. And I think for resolutions, they should be read into the record, and that I'm going to request that the sponsors may want to take this opportunity to read it into the record. Maybe one of the sponsors could do that.
I'd be glad to if the other sponsors are okay with that.
Go for it, Counselor Foster.
Absolutely.
All right.
It's better than all four of us together. That would be.
We hadn't rehearsed, so it feels like it should just be one of us.
It's a little late for that, yeah.
In the City Council, January 22nd, excuse me, Scrivener's area, that should be January 20th, 2022. Upon the recommendation of Councillor Jamila Gore, Councillor Karen Foster, Councillor Alex Jarrett, Councillor Rachel Maori, R 22.015, a resolution condemning anti-Semitism in our community. Whereas at the December 28th, 2021 Board of Health meeting, there were members of the public who made anti-Semitic comments, identified themselves using anti-Semitic tropes, and displayed Nazi symbols in their Zoom image. And whereas Northampton's health director and volunteer Board of Health members have, for nearly 2 years now, guided Northampton through the challenges presented by the COVID-19 pandemic, making difficult decisions in the interest of public health and protecting the residents of our city. And whereas anti-Semitism exacts a heavy toll on our Jewish community members, and like all forms of hate, seeks to create a larger environment of fear, division, intimidation, and oppression for all residents. And whereas Northampton has a long history of showing up on the side of equality and justice and standing up against hate and bigotry. And now therefore there be resolved that the City Council of Northampton, Massachusetts calls on all local public officials, residents, and visitors to stand in solidarity with our Jewish family, friends, neighbors, and community members, and condemn and denounce anti-Semitism in any form. Be it further resolved that the City Council of Northampton recognizes that the Health Department and Board of Health need to make difficult decisions in the interest of public health and to protect our community members. We commend them on their tireless dedication and leadership during the challenge of a global pandemic. And be it further resolved that the Administrative Assistant to the City Council shall send a copy of this resolution to Mayor Gina Louise Shara, Health Director Meredith O'Leary, and all members of the Board of Health.
Thank you. And
Move approval.
Second.
okay, so the motion was made by Councillor Jarrett.
Wait.
And
I think I don't do that yet unless we suspend the rules. We simply have a discussion first.
Oh, yeah. Okay,
So,
yeah, all right.
I'll take that back.
Okay, so.
And I take back my second.
All right, so now we allow the, first sponsors who'd like to speak to the resolution. Councillor Gore.
I just want to say that it's good for the council to have like a solidarity statement against anti-Semitism and the anti-Semitism that was expressed at that Board of Health meeting. And as we saw today, the Board of Health has been working tirelessly through this whole pandemic. And I think we need to commend them for that. And also we need to stand in a united front against hate and bigotry in our community and let it be known that we condemn it and we don't accept it here at all. And I think that we need to have a zero tolerance policy on that.
Thank you, Councillor. Councillor Maori.
Okay. Yeah, so, I mean, what does a resolution condemning anti-Semitism do? The honest answer is not what we long for it to do. To end the targeting of the Jewish community, to spare our Jewish family, friends, and neighbors the pain and the fear and the triggering, to shield them from the furthering of this outrageous human history we have of anti-Semitic genocide and scapegoating. It doesn't do those things. But what I do hope it does is prevent compounding the harm done by furthering the suffering of not having people, as Councilor Gorgeous said, let it be known, speak up. And so, you know, we see it here, we are naming it, and we're calling it wrong, and we are with you, and we will walk beside you as much as possible, no matter what, when these kind of arrows are thrown at anyone in our community. So, you know, studies on people and groups showed that studies on people and groups that are targeted showed that what bystanders and witnesses do makes all the difference in the amount of trauma experienced. There's a gaslighting that's part of all hate speech and all hate crimes, right? It's meant to demoralize and terrorize targeted communities. And so the value of a proclamation is that we are, this proclamation that we are making right now, you know, is to have a positive impact on something so toxic that has this toxic narrative. So even naming it like this, I think is powerful. Anti-Semitism is not just a political problem, it's a cultural one. It's critical that we model being active allies and bystanders. Silence simply is not an option. There is no neutral response to racism or anti-Semitism. If we don't condemn it, we are feeding it. Ally is not an identity anyone arrives at, but it's an ongoing, lifelong process of commitment and recommitment to action. And it involves a lot of thought and work. So allies don't have to have it all figured out, but we have to commit to deep listening, especially to the targeted communities, and taking action when needed, and non-complacency. So I invite the residents in our city to be active allies. And this is one thing I know that we can do. Thank you.
Thank you, Councillor. Councillor Foster.
Thank you. And I wanted to thank the co-sponsors as well. It was wonderful to collaborate with the three of you. You know, when I had sent an email out to the Ward 2 email list, just mentioning that the Board of Health meeting had happened and a couple of sentences condemning the anti-Semitism that had been brought up there, the response from Ward 2 was fairly tremendous. I just pulled up the exchanges I've had, and I had exchanges with 15 different constituents saying, what happened? What are we going to do about it? And it was really hard for me as a city councilor, the timing of it, that we couldn't introduce a resolution until tonight. So it is a process note I know you received on your email that we would respectfully request a vote on it tonight so that we can tell our community that we as a city council stand united against the anti-Semitism that has been rising, and the pandemic has deepened, well, so many things over the last many years have deepened and broadened divides and has increased scapegoating. And you know, at the beginning of the pandemic, we brought forth and passed unanimously a resolution condemning anti-Asian xenophobia and hate connected with the pandemic. And then as it's gone on, many of the restrictions that local boards of health and school committees have brought forth there's also been a simultaneous rise in anti-Semitism related to that. And it's something that we as leaders, as Councillor Mayari so eloquently stated, you know, a resolution won't do what we want, and that it won't necessarily stop it. But I just had to share, I received a one sentence email from one of my constituents who's Jewish, and it just brought forth to me the importance of our passing a resolution more than anything else could. And his email to me said, "Thank you, Counselor. When my parents were in German occupied Austria, no political leader stood up for them." And it just was like, yeah, like that's a power that we have as leaders in our community to stand against hate and intolerance and to stand up for people who are being targeted.
Counselor, I think Labarge had her hand up before Counselor Jarrett.
No, that's all right.
Okay, so Counselor Jarrett.
Thank you. Yeah, thank you to my co-sponsors and to the community members also who collaborated and did so much work on this resolution. I will second or third or fourth about how important it is to speak up when these incidents happen. I think they have a hidden cost on the community, planting seeds of division and fear. You know, the Jewish people have often been used as a scapegoat, which divides us, it thwarts us in fighting for social justice for everyone. So, you know, we must stand together in respecting everyone and discuss our differences based on the merits of the issue. So thanks everyone. And I hope that we can also suspend the rules and vote on this tonight. Thank you.
Thank you, Counselor. Counselor Elkins.
So I wanted to share that when I was reviewing the agenda and the resolution, you know, obviously I'm so glad to be a part of this body putting forward this this resolution. And I read in the paper today that in 1942, 80 years ago today, there was a 90-minute conference in Wannsee Lake outside of Berlin. And in that 90-minute conference, a group of government bureaucrats and civil servants not in any term of word that we use it, came up with the plan for the Holocaust, came up with the bureaucratic plan that was the implementation of the final solution. And it happened in 90 minutes. And and it was a 15-page document that, you know, put into motion the crushing gears of government to the evil purpose that was the Holocaust. And I just was really struck by the fact that today I'm part of a body in a city that would elect this group of people and who would seek to express as one of our core functions of this body, which is to put forward a resolution like this, to express our shared values and our aspirations. And I just really wanted to say that I was just really struck by the moment, struck by the community that we live in, and to say that we can be a part of a collective expression of values that's terrible, or we can live in this time, in this place, with these people and these neighbors and these community. And I'm so proud to stand and to share and put forward this resolution. And so unlike what those evil people did 80 years ago, we get to be a part of this body in this city. And I do stand and do say we can't stand for this kind of conduct and this kind of language and this kind of hate, and especially in the face of just the most hardworking public servants that we could ever hope to be in this endeavor with us. So I just wanted to say I'd be happy to support this, happy to suspend the rules, and I'm ready to put this statement of our collective values together out there in the world.
Councillor Moulton.
Yes, I want to echo what my colleagues have said. I spoke today with one of my constituents, Rabbi Ricky Kosofsky, who leads the Beit Ahava Reform Synagogue here in Northampton. And as you may have read in yesterday's Gazette, she was a rabbinical classmate of the rabbi in Texas at the synagogue that was violently attacked on Saturday. So she's been very close to that attack as well as what we witnessed here in Northampton. And I asked her what it means to the Jewish community to have an elected body like the City Council take on this resolution and affirm this resolution. And she said it's critically important because, in her words, the Jewish community often feels alone. So that underscores my belief that that this resolution is a show of solidarity, and it does make a difference.
I just want to express my gratitude for the work done by the 4 sponsors on this resolution. And also just the level of support and sharing that's gone on in this Zoom room tonight. It's really remarkable. And that, you know, for me, you know, I can't imagine a life without my Jewish friends and family. It's just been such a profound impact for me, and that I'm wholeheartedly going to be supporting this if we vote on this tonight in support of them. So, Councilor Labarge.
Yes, thank you, Council President. I wanted to wait to the last of hearing everybody speak. I received calls, and I have to thank our mayor, who was inaugurated on November 3rd. And 3 days later, she came forth and put an article and a press release to everybody about what had occurred here at the Board of Health meeting on December 28th. And many of people that have called me were so happy to have read that. Also, too, there were some of the counselors that were interviewed by the Gazette. Your names and our names were in the paper. I have many friends that are Jewish and very close to them. And this is very hurtful, very, very hurtful of what's occurred in this city. But what really is hurtful here in my heart, and you're going to hear it, because it doesn't leave you, believe me. Believe me, when you get hurt by what's happened here at the Board of Health, it stays there forever. In 2007, as a city councilor, I was attacked on the radio by a counselor of my heritage. I can't tell you the support I got from the people here in the city of Northampton. My friends who are Greek lawyers here in the city and also own businesses. Plus I am Portuguese. And my heritage was attacked. My family from Springfield, from our Greek Orthodox Church right down the line, were living with it. So I know how these people are feeling, my Jewish friends who have been attacked. It stays there. But here I was attacked by part of government in our city. And it was not the right way to go. Not the right way to go. And I know all these professional people that are on, our volunteers that are on the Board of Health, are so professional, but they did not deserve to have happen what happened to them. And I'm with them 100%. I'm with anybody in this city, no matter if you're Jewish, Polish, right down the line. Nobody's heritage or their sex or anything should be ever attacked by. So I will support this. And I have my reasons why in my heart.
Thank you, Counselor.
Hi, Annette. Hi, baby.
So we've had some discussion, and I think was some interest in that discussion of suspending the rules and passing this resolution tonight.
Move to suspend the rules.
Second.
Motion to suspend the rules made by Councilor Foster, seconded by Councilor Maori. Any discussion of suspending the rules? Roll call, Pam.
You're muted.
And just unmute. And
Clerk Powers, I believe you're muted.
No wonder you weren't answering me, Counselor Maori.
I was just being obstinate. I get fussy after 9. I stop answering people.
A long day. I thought they were telling you to unmute. So there you go.
Passing the buck.
Okay. Counselor Maori.
Yes.
Counselor Moulton.
Yes.
Counselor Nash.
yes.
Counselor Perry.
Yes.
Counselor Elkins.
Yes.
Counselor Foster.
Yes.
Counselor Gore.
Yes.
Counselor Jarrett.
Yes.
Counselor Labarge.
Yes.
Thank you.
So the motion to suspend the rules has passed unanimously. Do we have a motion to pass this resolution tonight?
Motion
Move
to pass
approval.
the resolution.
Motion.
I'll second it then.
So Counselor Gore made the motion. Who was the second?
Counselor Jarrett, I think.
All right, let's go with Counselor Jarrett. 2 sponsors. Let's do it. Any discussion on the motion to approve this evening? Okay, Pam, roll call.
Counselor Moulton.
Yes.
Counselor Nash.
Yes.
Counselor Perry.
Yes.
Counselor Elkins.
Yes.
Counselor Foster.
Yes.
Counselor Gore.
Yes.
Counselor Jarrett.
Yes.
Counselor Labarge.
Yes.
Counselor Maori.
Yes.
Thank you.
Okay. Next on the agenda, we're actually really close to done. I just wanted to take note that under new business that Counselor Jarrett and I had a discussion with City Solicitor Seawall, and this is the standing rule that we have in the council rules, which is here, which is that an item needs to be submitted in writing to be brought up under new business. But as we discussed it with with the city solicitor, we can broaden that to include just opening up discussions, and that under new business, something could come up during the meeting where somebody could make their intentions known for future legislation. As Councilor Dwight did at one point around, changing our rules. I'm going to propose that, for changes like this, that we start, we just start making a list of changes that we want to make to the rules, and that, and this being one of them, and that, that we're not going to make the list tonight, but as you see things that you'd like to see discussed, as we refine our rules, just make note of it and send it off to Laura, and we will put them all together as an agenda item to make amends, to amend things if we wish.
Okay.
Councilor Jarrett, did I cover that discussion with the city solicitor pretty well, or?
Yeah, thank you.
Okay. Councilor Maori.
Yeah, so are you saying, President, that can we discuss anything else besides an order, ordinance, or resolution? Or you're saying that's the change you'd like to see? I'm just thinking, I remember one meeting when after the pandemic started, for example, we might want to say, hey, I'd really like to get the health director back in, or something like that. And that's not an order, ordinance, or resolution. So I'm just trying to clarify.
That's the way we interpreted the what the city's solicitor was saying.
Okay, thank you.
But they're not items for discussion at
Right.
this particular meeting.
Got it. Right. It would have to be to say, in the future, I would like such a thing, or whatever.
Or I'm going to introduce, or whatever.
Okay.
And with for example, the resolution that we just brought forward, that was just brought forward by four sponsors, I think that intention existed at our last meeting, and that that it might have been, the timing might have been good to do that then.
Yeah, you're right.
So.
Yep.
Okay, it's been a pretty good long meeting, and I will entertain a motion to adjourn.
Move to adjourn.
Second.
Okay. Motion made by Counselor Labarge and seconded by, was it Counselor Gore?
Elkins.
Counselor Elkins.
Yeah.
I don't have stereo here. I can't tell where you guys are on the screen. Okay, there's no discussion of a motion to adjourn. Pam, roll call, please.
Counselor Nash,
Yes.
Counselor Perry,
Yes.
Counselor Elkins,
Yes.
Counselor Foster.
Yes, with big gratitude to you, Pam.
Thank you. Counselor Gore,
Yes.
Counselor Jarrett,
Yes.
Counselor Labarge,
Yes.
Counselor Maori,
Yes.
Counselor Moulton.
Yes.
Thank you, Pam.
Thanks, Pam.
Thank you.
Yes.
Yeah,
Thank you.
thank you.